today is the third day, so maybe some they will join within 5 to 10 minutes.
Yeah, they will join us.
So, but we will continue with our time. So we will start it.
Good morning and greeting to one and all. I am Dr. Varsha Jotwani, Associate Professor of CS and IT Department. As a moderator, welcome all the distinguished participants and the resource person. I would like to express my heartfelt gratitude to all of you who sincerely committed to this event to make it successful. Once again, welcome to the third day of FDP. Kindly please fill the feedback form at the end of each session. Today's topic of lecture is telemedicine challenges and opportunities in India and future of telemedicine. Before proceeding further toward to our lecture, let me introduce Dr. Shireen Jaffer. Dr. Shireen Jaffer is an assistant professor, computer science and engineering in the School of Engineering, Science and Technology, Jamia Hamdard. She has a vast experience in teaching and research management and also the research project work. She specializes in wireless network, soft computing, and network security. She has a vast experience of handling the national and international publication. She has been involved and coordinated various academic events too. Now I request Dr. Shireen Jaffer to take over the lecture and enlighten us with her experience and knowledge. Ma'am, please.
Thank you, ma'am. Very good morning to everybody, especially all the participants who have joined this particular FDP. Firstly, I would like to start with a particular quote: "Do it now or sometimes later will become never." Deep sense goes into this quote. And why talking about a deep sense? Because we are currently in this COVID-19 pandemic and most of us are at home. So we should take this time to develop new opportunities. We should take this time to learn new things. And what better than telemedicine? And why we are talking about telemedicine and why telemedicine plays a very important role, because nowadays, every time in every news channel, we talk about those frontline workers. And when we are talking about those frontline workers, and doctors play a very, very important role, we need to check into the paradigm that this particular art, which is called as telemedicine. And why I'm saying it as an art, because telemedicine is something which cannot be completed without the help of IoT, which cannot be completed without the help of artificial intelligence, which cannot be completed without the help of hardware and software. So if you think that you are doctors, and but you say that you are not very well versed with IT field, then this is the time, this is the particular scenario, this is the particular paradigm, this is the particular time to enhance your skills. And when we are talking about telemedicine and in the COVID-19 pandemic, and very, very important, since the particular topic deals with Indian specification. So when we are talking about telemedicine and Indian perspective, it's very, very important to understand for Indian perspective, telemedicine is much more important because number one, higher population, because India has a very, very high population as compared to other countries. Secondly, we have lot of people who are connected and who are living in villages. So it's very, very important to make a connection, make a rapport with them. Number three, and that's very, very important, we are in the era of COVID-19 and there is a lot of burden on the frontline workers. There is a lot of burden on the hospitals. So it's important to understand that we are here and we have been given an opportunity, because as I told you that For example, if COVID was not there, and if COVID wouldn't have occurred, we would have been less restless, and we would have been more towards like connecting with the direct to the doctor 1-to-1. Similarly, if COVID was not there, these online classes, these online webinars would have been less popular, would have been less accepted by the users. But now, since we have this paradigm, since we have this opportunity, and since we have this all environment where things need to be adapted and things need to be controlled, it's important that we adapt to this technology and we understand the basics. And it's very, very important for all of us to understand that, obviously, many people says that I am connected to that blackboard teaching. Many people say I am connected to visiting the doctor directly, unless and until the doctor check my nerves. We call that nerves in terms of when we have these hakim and all. Unless and until a doctor check my heartbeat, or doctor check me directly, I will be not satisfied with the medicine, or I will be not satisfied with the particular output he gives me. But we need to understand, second and most important thing, we need to understand that India is having a large percentage of doctors who are graduating and not finding the job. So it's important that we accept to this telemedicine culture and get grasped and get adapted to better technologies, so that once even if COVID-19 goes, and if things goes all well, still this new technology will play a very, very important role in our lives, as same as those online teaching and then the telemedicines, because these two technologies have nurtured in this COVID-19 pandemic. Okay, so since we have lot of around 100 audiences connected with us, and normally during my webinar, I always have that rapid fire with the audience, but this time I'll have a small rapid fire, a small one-to-one talk with the audiences at the end of the session, because we want that flow of the session to continue, and then I'll have a small one-to-one chat that will be a rapid fire, and then we'll have that question answer session at the end of the session. Okay, so I'll be starting my PPT with a small video, and why this video plays an important role, because everything that I was telling with my communication will be now be played in terms of a video. Okay, so just I'm sharing this particular slide. And I'll also be thankful, very, very thankful to Rabindranath Tagore University for giving me opportunity to talk about telemedicine. And since it is the need of the hour to talk about telemedicine in this COVID-19 pandemic scenario. Okay, so let's check there. think it said everything that is very, very important in terms of telemedicine. And why it said everything? Because the starting one shows that in India there are a number of doctors, and the percentage of doctors is rising at a very high scale. And now how to stand out, okay, how to stand out into that that you are the one of the better one, a better doctor. So you need to connect to the software, very, very important for everybody, because many of the doctors, many of the frontline workers resist themselves to be connected to the software. And as I told you, artificial intelligence, machine learning, deep learning, IoT will be one of the most important players in this market. And we cannot say that I know a little bit of IoT but I have no knowledge of machine learning, because they all are a kind of a perfect fit. Because when you are talking about any of these technologies, you are connected to computer technologies in one or another way. So it's very important that we as people of computer engineering field, we as people of pharmacies, and we as peoples of medicines all connect together to build a best fit, and to build a fit that will be a very, very important fit for the patients. Because the most important terminology that comes with telemedicine is the treatment of patients and engagement of patients. That's very important scenario, because when you are talking about treatment of the patients and engagement of the patients, it's important that those remote diagnoses should have the similar effect as if meeting with the patients in physically. As I tell my students during my classes that although I'm connected to you online, but with my classes, with my presentations, with my interactivity, I want you to feel that I am with you. Similarly, it's very important that those practitioners and people who are adopting to those telemedicines should engage their patients in a very, very healthier environment. I know pros and cons are there. I know disturbances will be there, issues will be there, and especially in terms of low income regions, and especially in terms of villages, there will be lot of issues. But we cannot say that these issues will stop the growth of telemedicines, but these issues will nurture to better and better opportunities for telemedicine. As in the 20th century, ECG was transmitted over telephone lines. It was the first like online transfer of that particular medical reports through the telephone lines. Then that delivery and as healthcare has nurtured into the usage of this technology. And India, the major role is played by the NASA and the ISRO. So when we are talking about the National Task Force of Health in India, in 2005 they came up with number of projects like that of ICMR, Arogya Shri. Then we have the NEHAs. Then we have the village remote communication system, that we have the VRCs. And it's very, very important that the close monitoring of the patients be done, because as I told you, we should be connected to our patients and our students in the similar manner, although the hurdles come, as if we are communicating them directly or physically. Okay, so when we are talking about telemedicine is divided into number of services. When we talk about the store and forward, in which we store the patient's history, and then we take out something in terms of better diagnosis. Then we have the remote communications, and we have the real-time communication where the doctor is connected to the patient in the real time. And it's very, very important that this disaster management, as I told you, COVID-19 pandemic has nurtured all things, because these all things were like in a box, and this COVID-19 COVID-19 has opened this telemedicine box in a more specific manner, because now it has become more demanding, because people now are taking less time and taking less interest in going out and meeting the doctor, rather than connecting with the doctor, sending them the reports. And it's very, very important that obviously, as I told you, to understand that telemedicine is not the solution to all the problems, but it's important to reduce the burden on the healthcare system. As I told you, the Indian healthcare system is not the world best. So in order to reduce those burden on the healthcare system, especially in terms of this pandemic and disaster, we should be adopted and we should accept telemedicine in a very, very healthier manner. And when it comes into telemetry, it is kind of reinventing healthcare delivery. It's the term very, very specifically specifies reinvention. And when we are talking about reinvention, why we say reinvention, as I told you, this is not something very much new. It was there. As I told you, when we talk about those online classes, when we talk about those LMS, those RMS, and various types of software system, we cannot say that they were not there. They were there, but they were in the closed box. And when they were in the closed box, people were not very, very much interested. People were not very much taking into specification the utilization of those resources. But now, when we are talking about telemedicine, and when we are talking about these online FDPs and classes, they have become the need of hour. And as I told you, when we're talking about the Gangaram Hospital in Delhi or the Trivandrum Regional Cancer Center, they have already established very good telemedicine services. So this is not something very new. It was in the box. And when we're talking about the Sanjay Gandhi Postgraduate Institute of Medical Sciences and many, many more examples that I will be quoting you, these all have utilized the telemedicines in Indian perspective in a very good manner, especially when we talk about those Kumbh Melas and all. In those particular scenario, when we have lot of public there and we have lot of people going outside, and in Uttar Pradesh, normally lot of people come to those Kumbh Melas and all. At that time also, the telemedicine was playing a very, very important role. And when we talk about those Narayana Hridayalaya, Apollo Institutes, the Escort Institutes, the Amrita Institute of Medical Sciences, and Arvind Eye Care, these all are the organizations, and they are the state government and some government organizations, and even the ISRO are updating and enhancing their telemedicine capabilities in order to serve the patients in a very, very healthier manner. This is one of the pick. So as I told you, this is a very, very older pick, and this is not a pick of current COVID-19 pandemic. It is Amrita Vishwa Vidyapeetham, and they are already utilized, and they have built a center for digital health, and it is called as a wireless telemedicine. And the doctors and the patients interact in a very fruitful manner, and they have a very strong connectivity in order to establish that goal, that digital health goal, in order to reduce the burden on the healthcare providers. And see those smiling faces. And why we are talking about those smiling faces? Because obviously those smiling faces specify that both the parties have adopted to these technologies, and it is happening. And as I told you, this is not the current picture, it is an older picture which shows that telemedicine has nurtured itself from 2005, and also going on in order to get the best out of those system and those opportunities we have. So when we talk about, especially in India, in terms of those remote hospitals and a lot of rural hospitals, in terms of Andaman Nicobar and the Lakshadweep and the Jammu and Kashmir and various types of states in Orissa also, these district hospitals are utilizing the concept of telemedicine. Similarly, as I told you, ISRO is working it at a very fast rate, and there was a telemedicine pilot project in 2001, and it linked the Chennai Apollo Hospital with the Apollo Rural Hospital at Aragonda village in Chittoor, that is Andhra Pradesh. Similarly, a lot of work has been done by the Department of Information Technology. As I told you, this is these are the two hands. You cannot say that information technology and healthcare are apart. They both need to work together. So if there is ISRO, there is Department of Information Technology, and similarly the welfare and the family health department, they are giving and paving a way for the telemedicine services in India. And various projects, when we talk about those projects in terms of these IDSP, the IDSP is the Integrated Disease Surveillance Project, and we have the National Cancer Network, that is OncoNet, and the National Rural Telemedicine Network, and we have the National Medical College Network and the Digital Medical Library Network. They all are doing a lot of work in public health care, and they are working with the government in order to provide telemedicine support to the people, especially in the villages. And in 2005, even the National Telemedicine Task Force was developed by the Health Ministry, and it is working with various types of projects in India, and also the Pan-African E-Network project. Then we have the SARC project, South Asian Association Corporation projects. They are also working with different international organizations in order to accept telemedicine and Indian telemedicine, and placing that Indian telemedicine in the global scenario, because it's important for people to accept it, because we have so many doctors in India which are going abroad and doing services. If our Indian doctors stay here, and if the government help them in terms of better opportunities, why they'll go there, they'll help the people of India. And even they can be anywhere in the country, but they can serve the villages people, because for them the requirement of telemedicine is more. And why more? Because the hospitals and the services are lesser. So current scenario, if we talk about, the WHO says that there should be one out of, in terms of telemedicine, thousands, while the current doctor ratio of India is 0.62. But when we are talking about this ratio is increasing by 2030, and this deficiency will reduce. But the thing is that each time providing training to the doctors in terms of time and money, it could be better if we could adopt to those new technologies. And when we talk about telemedicine, it comes into the Ministry of the Health and Family Welfare and Department of Technology. And the government of India is developing those e-network and e-health, establishing a national medical college network for interlinking the various type of medical colleges and the e-education and the rural medicine network with the e-healthcare delivery. And as I told you, there's another project with the National Health Portal, NHP, and we have the National Digital Authority of India have developed the National E-Authority, that is also called as NEHA. It is being set up with the vision of achieving high quality healthcare services, and ICT is playing a very important role in that. And it's important to specify that those telemedicine practices follow a set of electronic health record standards which have been specified in 2019. And it's important that telemedicine practices are extended to the fields of traditional medicines, because we need to come out of that. We have circle that the traditional medicines and traditional technologies are important. They are important, but those circle need to be come out in order to help people at a faster rate. That's very important. Let's see this particular video. Again, an interesting video will show you how telemedicine is playing an important role, and not from today, from many years before. Let's check this. Just a sec.
In this eye clinic in Undipati village in Tamil Nadu state, patients are seeing things a little differently. Raja Manikam complains about an eye injury, And 15 kilometers away, an ophthalmologist at the Aravind Eye Hospital in the city of Teni diagnoses and treats him. Both are connected through an inexpensive Wi-Fi video conferencing network. It is called telemedicine, and it is increasing access to care in a country that is home to the world's largest number of blind people. 8 vision centers have opened over the past 6 years in Teni district. The centers are run by an ophthalmic assistant who is trained to conduct a full eye examination, administer diagnostic tests, treat simple ailments, and prescribe glasses. A doctor at centers as far as 150 kilometers away gives the final word to villagers.
It is a useful instrument for the villagers. We can actually talk to the doctor directly from here.
Rajamanikam normally would spend a full day traveling to the Aravind Eye Hospital. Instead, he traveled only 3 kilometers by a local bus to this vision center in his village. His exam cost about 50 cents, half what it would cost at the hospital. He saved $2 on transportation, which he says he can now use for medicines. The assistant also found a cataract in Rajamanikam's eye, which will require surgery at the hospital. Doctors say this early detection has prevented Rajamanikam from becoming blind. Under the World Health Organization 2020 initiative, India has pledged to eliminate avoidable blindness in 10 years. The WHO reports that about a third of the world's 45 million blind people live in India, and the majority of causes, such as cataracts and diabetes, are treatable. Aravind Eye Hospital has conducted mobile eye camps in villages across Tamil Nadu over the past 2 decades. Eye doctors have administered day-long screenings to roughly 750 patients per village each year. Now, with the Vision Center in place, doctors are treating an average of 5,000 patients per center per year. Each center is connected to the main hospital by video towers, designed with the help of students at the University of California, Berkeley, in the United States. The towers cost $2,200 to set up, but very little to operate. Dr. P. Namparmalsamy is chairman of Aravind Eye Hospital. He says the scarcity of doctors in India made video treatment essential.
You may say that it is not, you're not touching the patient, you're not talking to the patient, but left alone, what they will do is they will put native medicines or some unwanted medicines and spoil their eyes. This is better than that.
The Indian government plans to set up 20,000 more rural vision centers in the coming years. Linda Blake for VOA News, Teni, India.
So, very, it's important that these particular videos showed us that telemedicine is not something that was that is new, but telemedicine is India has adopted to this. And very important thing that I and many of the participants should have taken from this video is number 1 is Wi-Fi centers, setting up Wi-Fi centers. And as I told you, this cannot be completed unless and until ICT people, unless and until technology people are connected with this particular telemedicine environment. Second, with Indian people, villagers especially, who are taking around they are walking kilometers to kilometers, and as it was told in the video, it was 4 days of traveling in order to reach a particular hospital. Now that person is able to walk only just 3 kilometers and get his eye tested. Then half the money the person is spending, and that money could be spent and kept for medicine. This is again very, very advantageous. And very important thing is early detection, because when we are talking about those cataracts, if the late detection could have made people blind, so early detection could help him getting the surgery. And these video towers can be set up by, because India now setting up so many engineering institutes, and a lot of computer engineering students are now being into this particular scenario where they know how to build those setups, so they can be utilized for building up those video towers. And it's important that once that tower set up, then we have very little little to operate, then we don't have to put a lot of money there. And when we are talking about the scarcity of doctors also, this will be overcome, especially people going to the villages. Doctors, a lot of doctors not preferring going to those villages, so they can be directly connected to the patients even they are hundreds of kilometers apart. And very important, highlighted the video that normally what do the villagers do? They normally take an unwanted medicine. They normally take those home remedies which could be very dangerous, especially in case of these eyes and specific organs, and they can harm them. So that's very, very important, that as specified, that around 20,000 more these institutes and those telemedicine centers are being adopted and will be built and are on the process and have been built. So this type of culture is need to be adapted. And I know there is scarcity, I know there are issues, but we cannot say that lending our bow down with those issues. We should be always be risen up in order to fight against any odds. Okay, so let's proceed forward to check what we are now getting more here. Again, important thing is that, as I told you, that these village resource centers that have been developed by ISRO, and they are very, very important development centers, because they provide those interactive online decision supports directly to the villagers. And those village resource centers, around 500 VRCs have been established across the countries, and especially they are helping to those villagers. Then Arogyashree is again an internet-based mobile telemedicine that integrates with number of hospitals and mobile clinics. And the project is being developed by ICMR, and they have a lot of scientists and people working in collaboration even in Germany and other international organizations. People are working in collaboration of the telemedicine setup in India, and they are working on that ECG jacket design for the continuous monitoring of the patient's ECG without hospitalization. So this is also very important, and this is a part of remote monitoring, which could be very, very helpful in terms of the Indian specific scenario. Then we have the e-Sanjeevani OPD. Now, I think, as I told you, that this telemedicine market, it's very important to understand that this COVID-19 scenario has led to more of opening that box, and those digital health plans have been opened. And those digital health plans now are being specified that when we are talking about those number of projects that were normally launched or not picking up the speed, now it's important that in response to those COVID-19 pandemic, the Indian government in March 2020 gave new guidelines for those particular chronic patients, medicinal support and all. And then Ministry of Health launched an e-Sanjeevani OPD. It is a very important patient to doctor teleconsultation services, and around 1 million telemedicine consultations have been completed through that e-Sanjeevani OPD. So when we say that India is lagging behind in telemedicines compared to other developed countries, yes, but it is doing a lot of work in order to be connected into that paradigm, because whether or not pandemic is there or not, these new technologies need to be adapted in a very, very efficient and aggressive manner. Not that because a pandemic is there you are adopting, but you should be connected to these technologies in a very healthier manner. Then as I told you, that e-Sanjeevani OPD, you can do those registrations, and there's a doctor and patient connectivity very enhancedly being done, and this is all Indian product. And let's show a small video which will tell you everything about the e-Sanjeevani OPD. Can be easily installed from the Play Store. you are registering in the e-Sanjeevani. Show all the states who are being connected with this particular technology. Of uploading your health records also, so that doctor can better diagnose what are the issues you are facing. We are going with the special OPD, and the token is then sent to your number, and you receive a token there. Connected with the hub of the doctors. And you're waiting for your turn. Prescription also, and you can add other family members also with that. You get your prescription that is being all given by the doctor. Environment, but it's important that those ICT skills need to be nurtured. There are various types of technologies that are in the scenario. And very easy methodology, which told you that this particular scenario and these e-Sanjeevani OPDs, millions of people have done those consultation. I know that there are issues of network, there are issues of people who are not connected to a lot of mobile phones and lot of technologies or smartphones, but as I always tell during my every lectures that each one should help those 3 people and the 2 people or 1 people. And why? Because if any extra things that you have, you can lend to those people who are into their needs, so that they can also be connected to technologies, and they can also, because we have ample amount of things that are extra at our home, so it's important that we connect, we specify those technologies in terms of a better scenario to help others also. And when we are talking about this COVID-19 scenario, it's important to understand that the people are coming from those serious and non-serious conditions, and need to understand that the patients are into those areas where telemedicine cannot be adopted. So you need to work forward, you need to provide solutions for them. Similarly, when we are talking about some apps like Practo or the Dogs app, their usage and their teleconsultation have increased mainfold from March 2020, and a lot of diagnostic services and e-pharmacies have been adopted by the people in a very, very friendlier manner. And know, as I discussed, that there are disadvantages. That the disadvantages can be from the misconception of the symptoms by the patients, those misinterpretation of the symptoms by the physicians, those misdiagnoses. These are the issues that they are prevailing, and these are some medical issues that they are prevailing. But the thing is that adaptation, because this COVID-19 pandemic, as I told you, the box is being opened and we are adapting to more. As we go on adapting, this culture would be friendlier, because in the last year we were little bit hazy adapting to those online teaching, we were little bit hazy adapting to those solutions in which people were connecting to those online telemedicine or teaching, etc. But now in this year, people are now better versed, people are now better connected to those solutions. Now coming off those other issues like those network issues and those app usage and familiarity issues by the technology challenged people, and cyber threats also is a big issue that is prevailing, because of lot of huge amount of data that is being traveling through all those telemedicine environment and those tele-home monitoring environment. But with artificial intelligence there and with cyber security, a lot of work is being done. So these things will provide some solutions to those cyber attacks and hacks. And when we are talking about in August 2020, the National Digital Health Mission, that the NDHM has provided the support with the budget of that is around 4.7 billion. And what the NDHM is doing, NDHM is getting those health IDs, those personal health record, and a DigiDoctor facility is being provided with the registration. This will help in terms of connecting to the people in those healthcare scenario, in those healthcare environment in a very, very efficient manner. Because when we have those IDs, because when you're talking about those IDs and records, the lot of machine learning algorithms can provide predictive analysis, healthier solutions, more better diagnosis and research. And in those pandemic, when we're talking about those emergency and medical procedures, reduce the pressure on the healthcare environment, and especially where medical facilities are not up to the mark. And it's important to ensure that this security and the privacy of the health data of the people is being maintained. And it's important, which is being specified by the NDHM, that this is a diverse digital health plan and it should be accepted by the people in a very, very healthier manner. So let's check here again a small video which will tell you how the doctors are playing a very, very important
Being a doctor is not just a profession or a passion, but it is a compassion too.
compassion.
Doctors are saving many lives at the risk of their own life. Each and every doctor deserves a great round of applause. But how are you taking care of your regular patients? Through phone call? WhatsApp? Skype? Do they have electronic medical record? If not, how sure are you on medico-legal aspects? Ministry of Health and Family Welfare issued specific guidelines on telemedicine services. In Super Session of Medical Council of India, the Board of Governors prepared the detailed telemedicine practice guidelines. In its Article 343, emphasizes the need of extensive medical record of the patient in telemedicine. Give the best services to your patients while you remain medico-legally secured. We set up your telemedicine service in less than 1 hour in unbelievably low cost. Hospitals, nursing homes, individual doctors and polyclinics can best use our telemedicine technology. With most advanced telemedicine platform, retain your patients, maintain the records, and expand your reach. For details, contact 799.
So
Being
these are the services that are being started by, even if there's e-dot and there are a lot of services being started which will help the telemedicine environment to nurture, to grow, and to pave it scenario in terms of better understanding and better connectivity and engagement of the patient is very, very important. Now, when you talk about those challenges in terms of India, the challenges are much more. In terms of India, the challenges are much vaster. But I know these are not only the challenges, but they have the solutions also with it. Because I, on my personal note, always believe that every challenge has a solution for it. If you look at the challenge only, if you look at the disadvantage only, and never pave your way towards going for the solution, then it's a total collapse. Until you have a solution, maybe if that solution is not very realistic, just try it out. It need to be tried out to be to get the disadvantages of it. Because as I tell many of my PhD students and many of my MTech students, they say, ma'am, I'm not going for that particular journal, my paper will be rejected. I say, okay, let it be, let it get rejected. I want those negative comments, because those negative comments will pave your way for the better acceptance of your paper in the next journey. So when we're talking about Indian scenario, number one and the most important is distribution of those healthcare infrastructure, because we have the resource challenges, we have these population challenges, and we have those telemedicine issues and infrastructure challenges being specified. But now what we have done, as I told you in some videos also, these teleconsultations are being done by those community healthcare workers, and they do what? They follow a checklist based and assessment, and then they contact the clinician to provide a real-time consultation. That was shown in that video where the people were getting those eye being tested. And it's important that those challenges of mobile phones and functional literacy, these are being solved, and these are being solved by a setup, because the people of villages don't have those all set up at their home or at their other scenarios. So they can visit those telemedicine centers, and where teleconsultation is easily provided through this approach. And it's important that those interactivity can be provided through those voice services, through those video services, so that the delivery and the distribution can be done in a healthier manner. Because for Indian perspective, just setting up of centers will not serve the purpose. This delivery and distribution is very, very important. And as I told you and shown you in that video, there are 2 or 3 people who are actually not the specialist doctors, but they have the information, or ICT control people. Then they are the people who have the knowledge of the checking of the eye. So 2-3 people are being set up, and they then contact the person, the specialist doctors, and then the distribution and delivery can be easier. There are challenges, but there are solutions for that also. Then when we are going with another important issue is the mainstreaming. It's important because, as I told you, for Indian perspective, we cannot say that we have just the scenario where where you are just building up. And telemedicine, as I told you, in terms of natural disasters, this picture has been risen into a lot specifically. But as I told you, that once COVID goes, we will again close that box. No, let the box be open. Let those technological advancement and let those issues be solved. Because if the box will be opened, issues will come and issues will be solved. Because once the box is closed, obviously there will be no issues to be looked upon. And it's important that those clinical enabled infrastructure setup is being done with very clear defined roles roles, those responsibilities, those benefits. It's important because people, if a doctor, if a person is going into those villages, then those benefits and the risk for the stakeholders, because we are seeing that our mainstream doctors, around 1,000 to 2,000 doctors have been died in this COVID-19. So what are the benefits and what are the risks that are involved, and including the financial reimbursement, those remote care deliveries. It's important that this things should be regulated, these things should be done, because then it will prove to the world that India is also coming into the mainstreaming of the telemedicine. Another important thing is that need to specify that those multi-sectoral coordination, very, very important. As I told you that for medical health professionals, ICT people, they need to be collaborated, work need to be done, because many of the doctors who are not very well versed with those ICTs, and those ICT people who are not very well versed with some those pharmacies issues and those medical issues, they need to work in collaboration, because those collaboration, those multi-sectoral coordination will help the government. Every time I know that we are raising issues with the government, whether it's the central or the state, but things need to be done from our control also, because we need to establish an ecosystem, and these ecosystems should have those budgetary allocations where this telemedicine can come into the mainstream utilization. So talking about the mainstream utilization, it's important to understand that the issues prevailing with telemedicines have the solutions involved. Then the third most important issue is the scalability link network and these repository of healthcare offerings. It's important that these we have lot of resources, we have lot of people, because India, when we say the population is higher, the resources are also there, people are also there. So there is a successful telemedicine initiative, and it says that those healthcare delivery capacity can be extended by not only building the infrastructure but meeting those requirements and better user experiences, but one-to-one. Okay, because you cannot say you set up, you build a setup where Wi-Fi is there, your modem is there, your video, but it's not working, network is not coming, so their scalability is not there. Then repository of health, you are not offering anything. So the thing is that the scalability can be enhanced as those health IT experts, the Digital India Association, they need to collate the best medical telemedicine implementations, and it's important that the expectations of the rural, the semi-urban, and the urban settings should be specified, because these are very, very different settings. Because I sitting in Delhi have a control, I can directly connect to the Practo app or any telemedicine doctor, but a person sitting in Indian villages don't have those solutions. So you have to provide strict guidelines, strict scalability framework for the solutions for those urban, those rural, and those semi-urban settings, because WHO has also specified detailed compliance and standards adhering to the telemedicine guidelines that were provided in India during that COVID-19 pandemic in 2020. So it's important to understand that WHO guidelines and the issues are also being held upon and looked upon. Then these issues are prevailing, and these are also some of the issues with the security. As I told you, when you are using your WhatsApp, when you are using your Facebook, there are issues of data being traveling, and there's a lot of issues with the WhatsApp security also being raised many a times. So it's important. I know that the solutions are not very much like robust in terms of the security breaches, but it's important that the real-time data, those public health responses, and those real-time information and those end-to-end encryption should be done. It's not the only solution and it's not the utmost solution, but it's important that that solution should be done for those vulnerabilities in terms of the security, in terms of the settings, in terms of the personal healthcare information. And every telemedicine network should have a rapid data security audits. Very important, because when we are issuing those demands that are posed by the COVID-19 pandemic, so it's important that these data security audits need to be done to meet the data security demands. Very, very important. This is also the issues, and I have told you the solutions as well. Now it's important that India's push, because as I told you, every time I'm saying that example, that box is closed, that box was closed, and the COVID-19 pandemic has opened that box. So that push has been given, that that kick has been given, provided. So what the Indian government need to do, that the primary care networks, the health and wellness centers which are running in the Ayushman Bharat, they have been much more established. And as I told you, there are telemedicine guidelines that in the 2020 they provide those guidelines to utilization of telemedicine's behavior and the settings and the guidelines. It's important that citizens should be empowered in terms of a better experience in a healthcare delivery, and it's important that these facilities in terms of various types of systems like the Niti Aayog and the New India Building Blocks, pathways to reforms, these all communities should push towards those telemedicines, and lot of human experts need to be bring into advantage, because when we told that in this COVID-19 the final year students were involved in order to helping the healthcare professionals, so similarly those people could be working in those centers, those telemedicine centers, guiding although they are not specialists, but they can work as a workforce towards the development of that better telemedicine environment, because the push will be given by them only, because they are people who are under training. They don't require those training and extra effort to be provided. Similarly, final year BTech computer engineering students, they need to be involved, so that workforce need to be kept into the market, because that workforce sitting at home will serve no purpose. It's important that the advantage of that COVID-19 should be taken, because that push will be continued in a very, very healthier manner. And it's important to understand that the future of telemedicine is on those solutions. The 4 or 5 disadvantages I told you, and I had those solutions also with them. So the lot of future and lot of specifications depend on those scenarios, because unless and until, as I told you, unless and until there is a push, unless and until there is scalability, unless and until the workforce is involved, unless and until number of sectors are being collaborated, even if there is those pharmacy people, those doctors, frontline workers, ASHA care workers, then we have the IT professionals, hardware engineers, software engineers, then this will be working as a workforce. This will be working as a solution towards building of a healthier telemedicine environment, and this will be a future and it will not only be the solution for any kind of when only we have those pandemics, or when only we have those those issues of those pandemics, or issues of those when we are talking about these disaster management, then only the picture will not come into the market. It will be a constant support. As we are talking about online teaching, this online teaching is very adaptable nowadays. It's the COVID-19 pandemic, but for future scenario also we are doing many of when our colleges were open, we were doing has some online, some offline. So this paradigm has mixed very well. So let's see how those future solutions are being helpful into the market. Let's check that out. Okay, just a sec. Okay. So let's check the new normal with a small video.
The future of healthcare is often portrayed with a robot or artificial intelligence. While some of that is happening on the fringes, the real future of healthcare is emerging right now, and it's happening because of the pandemic.
Coronavirus is not a 2 to 3 month problem. We are going to be struggling with this directly for months and months and indirectly for years. So healthcare needs to change.
A new normal for healthcare is being established, and your doctor's visit may never be the same again.
There is no reason that healthcare needs to operate the way that it does.
This is Dr. Carolyn Jasic, Chief Medical Officer for the digital health company Omada.
At our company, we work with folks with obesity and diabetes and hypertension, the top 3 identified conditions that make you most at risk for complications for COVID. We have to figure out how to serve these patients in their homes, and that's really new for healthcare.
$41 billion of venture capital funds have been spent on digital health companies. Most have failed, partially because few employees ever use their telemedicine programs, even though 90% of large companies offered them. HIPAA regulations and other rules have also curbed the industry's development.
It is easier and more convenient to order a cheeseburger from McDonald's on an app than it is to access healthcare in America.
Previous to the pandemic, insurance would only pay for services at the point of care, meaning a patient receiving treatment at the doctor's office or hospital. But this has all changed in the last couple of months, driven by the largest insurer in the United States, Medicaid and Medicare.
Barriers that were seemingly insurmountable, things like reimbursement and cross-state licensure, are now being solved in order to get these solutions out to people. And that's exciting to see these things getting into people's hands for the first time.
On April 30th, the Centers for Medicare and Medicaid Services allowed for digital health reimbursements and relaxed rules around video visits. It has spawned over 80 new services so far, and that number is only going to increase. For doctors and clinicians, they've had to quickly hack together solutions so they can continue to serve patients. If their practice doesn't already have an app, they're using Zoom or FaceTime, services that were forbidden to use previously. Now, healthcare companies are seeing astronomical increases in video visits. Other things, like prescription filling, have become that much easier. And for clinicians, who only used to be licensed to treat patients in their same state, they're now allowed to treat patients across the country.
For the first time, through a smartphone, people can get efficient, high-quality care at an affordable price with good outcomes at a time when people really need that.
But the question is this here to stay? As we ride the waves of coronavirus, and everyone has to use all of these digital tools, will we get used to them? Will we have a better healthcare system with people doing most of their visits from home and only going into the clinic when absolutely necessary? Are we living through a fundamental shift in the healthcare model? Investors seem to think so, as funding for new digital health companies exploded in the first quarter of 2020.
I don't believe that healthcare will ever be the same again.
You look back a century ago at medicine, and the tools and procedures that people were using seemed crazy. Cocaine as medicine, no gloves for surgery, ambulance by horse. But that was cutting edge for its time. What will our descendants look at now that they'll view as archaic? Will the idea that we regularly went in to see our doctor be laughable? That we waited until something hurt to find out that we had a health problem? That we paid astronomical amounts for the simplest of visits?
I'm so proud of the health tech community that we've been able to step up during this time and that we've been ready for it.
The losses from COVID-19 are devastating, but hopefully this change in how we deliver healthcare may in the end save millions of lives. Thanks for watching. If you liked this video,
It's important to understand understand the new normal, because as I told you, people are very hesitant to get this output, to accept these solutions, because as I told you, the video was of United States, which is a much better infrastructure, much better environment in terms of medical and healthcare facilities, but still people are very much hesitant to adapt to these technologies. But if the things are more clearer, more easier, more advantages, more better solutions, more better outputs, more better diagnosis is being done, and this will be done if the box is opened only. If there's only we are not confined to those disaster management solutions, or we are not confined only to the solutions where we have those issues of COVID-19, something like that. It's important that the solutions need to be adopted. And for Indian perspectively, silently, the India's healthcare ecosystem has been made those telemedicine ready, because as I told you, the box was closed. So silently now the box is open, and the solutions are being done in order to get the best possible answers. So when we talk about India's future in telemedicine, yes, it's important to understand that there is a paradigm shift, as I told you, from the offline to the online, from the blackboard to that those laptop boards. There's a paradigm shift, and there is a reform, and this medical assistance in terms of those necessity in the pandemic, it's important to understand. And it's important that people are there at homes. So it's many of the videos show that this virus is going to stay. So it's important to understand that those online consultations should be taken seriously, should be adapted by both the parties, because this is a very interesting picture, and how this picture is being specified that doctor is coming out of your laptop, although it will not happen. But this is the feeling, as I told you, that I tell to my students, that the feeling that you are actually connected to the doctor, unless and until this comes into the picture, you will not adapt to these technologies in a very healthier manner. And you need to understand that there is a horizon, and telemedicine will be staying. And when there was a survey being conducted, would you consult with the doctor in the online future, about 74% people told yes. And obviously the survey was more with the urban people, and I know that there should be distinction between those semi-urban, those rural sectors is important to highlight. But around 2025, 30%, 31% compound annual growth in this telemedicine market. It's not limited to making doctor consultation easy, not only those online consultations, but digitizing those patients' health records, and connecting with the patients in a more healthier manner, and to provide better diagnosis, better predictive analysis, better machine learning and artificial intelligence, better devices, better diagnosis, because this is the need of the hour. Because only online consultation is not the solution, but the new horizon needs to be adapted. And it's very important that at a time when India is already in the need of more skilled healthcare staff and even better infrastructure, telemedicine can come to handy and transform that landscape in a cost efficient and assist light system, because there's a lighter system, and it is also a cost efficient system where people are connected very easily and very practically to the doctors in terms of the issues that were coming with the disaster management system. And it's important to understand that the people are paving the way of standing in those lines, waiting for the doctors in hours, and the doctors need to be bring more closer to the patients. And this environment of telemedicine will nurture if the trust and reliability is being nurtured by the doctors and the patients in terms of innovations, in terms of in a very seamless manner. Because unless and until something is adapted in a very adaptive manner, in a very trust-based, reliable manner, we as people will not adapt, especially in terms of our health and especially in terms of their diseases that people have. So it's important to book an appointment into the doctor, logging into a particular app, app and logging in only when the scheduled time arrives. And as it is being already discussed that COVID-19, the lifestyle and the disease culture and the those vulnerability have increased a lot, and it's important that those benefits of the telemedicine now need to be nurtured into the people in a very, very healthier manner. And people who are sitting in far-flung places and doctors who are sitting in far remote locations, and those poor internet connectivities are the issues. So the virtual visits are still favored there, and those crowded clinics, those medical facilities. Obviously, it's important to understand that for Indian perspective, those IT structure also need to be held more closely, and lot of work need to be done on those network and connectivity. These things that family doctor, I'll show only my issues to my family doctor, and if the family doctor is not available, you are not showing, you're doing some self medicines and self Google medicine. Nowadays we have that culture that people are Googling and getting the answers if I have a headache, if I have those issues, and taking their medicine on own, which can be very, very disastrous for your health. And sustainability, that's the thing I am always focusing throughout my PPT and throughout my connectivity. It's important to understand that these sustainability is being done, sustainability is being maintained, especially when we talk about women who are often in terms of rural communities, who are often deprived of those basic amenities. And we had seen that lot of issues related to women, and women were dying in those pregnancies and those particular issues because they had those awareness was not there, freedom of choice was not there, inability to reach to the doctors, traveling miles to reach to the doctors. So this are the issues that will be lot of solved by the telemedicine environment. And because women, many of the issues, they need more attention than men, because many of the issues women face that require much more attention, that require much more healthier guidelines. Because many of the issues, if consultation done by some kinds of gynecologist, sometimes of even those people who have those dietitians and they are connected to the people, they'll provide much, because physical meeting not required if it's not very, very much complicated issue. But the thing is that the women, if in the rural and the semi-urban, are not aware. So you need to make them aware in order to provide a much healthier healthcare environment for Indian perspective. So let's move forward. And as I told you, that telemedicine will go a long way, because those lot of medical waste and visiting the doctor and those carbon footprints in terms of traveling, a lot of traveling, and there's virtual prescriptions is being provided, and you have those doctor to doctor training. And it's important to understand that these solutions are being made in a very, very healthier environment, because as again and again I'm telling, this sustainability is the word. Sustainability is the word, because it's important to understand that the patient monitoring and the connectivity to the patient and those crucial remote monitoring need to be done, because early detection will save a lot of life. Early detection will help reduce the burden on the healthcare system. And in terms of Australia, in terms of virtual hospital setups, in UK, a lot of work is done on telemedicine, and in African nations are using telemedicines to bridge that health gap. Because many of the issues that in African countries faced were the issues of there were a lot of healthcare reduced facilities. And for India, it's important to understand that the emergence in the telemedicine globally is this time, because you have been provided a platform. The box is opened, the platform is being provided. Nurture it in a very, very fruitful manner. The task force is there. The task force needs to be nurtured. The infrastructure is there. The lightening of that infrastructure needs to be done. Let's check here a small video for your connectivity.
What comes to your mind when you think about managing your health and wellness? Procrastination? Long lines? Travel to the clinic? Or visits to the chemist? Thankfully not with the invention of telehealth. But what is telehealth? Consulting a qualified doctor from the comfort and safety of your home. A convenient virtual visit to the doctor. Telehealth seamlessly connects you to a doctor who diagnoses and solves your medical conditions remotely and gives you convenient and remote access to medication and solutions. And at Man Matters, we do just that. Step 1. You take a wellness assessment so the doctor understands your needs. Step 2. You get a free audio or video doctor consultation online. No queues, no hassles. Step 3. You get a customized regimen that suits you. Step 4. You get wellness at your doorstep, discreetly delivered. Step 5. You get ongoing care with follow-ups from the doctor. Be it hair, skin, weight, performance, or sleep, if it matters to you, it matters to us. We are Man Matters, a digital health clinic for men. What?
It's important to understand that there are a number of tools for that digital health, the telehealth implementation, and we need to look upon those tools. And in order to nurture, in order to help those people to adapt to better telemedicine environment. So for Indian perspective also, those tools could be utilized, those tools could be become the basic environment for our technology also. It's important to have better endpoints because as I told you, unless until you have those computers or smartphones, those tablets, they are the hardware required to implement telemedicine. And obviously connectivity, very, very important. I'm going from the basic because endpoints should be there, the network hardware should be there, then routers and modems and those internet service providers should work, build an environment, especially for the rural and the semi-urban areas, because I think urban areas have much better endpoints and network hardwares, but this work need to be done. A lot of work need to be done in the urban and the semi-urban areas. Then obviously video conferencing is one of the basic tool, one of the basic an important type of telehealth software. So those cameras and those mics and some types of telehealth specialists, they recommend the Logitech's C930E as having a very good video quality and sound quality for teletherapy. So this also need to be looked upon. What are the advantages that provide? Indian version can be developed for it. And it's important that those standalone webcams should be there. Those endpoints and network hardware should be into the paradigm to build that environment, because unless and until those setup is being built, the solutions will not be provided. Similarly, then we have the remote patient monitoring hardwares, those smartwatches, because some are required for real time. Then we have the remote patient. These are very, very popular nowadays in the urban areas. Those we have the smartwatches, those blood pressure cuffs, these ECG devices, those thermometers, those digital stethoscopes, scales, other medical devices. Nowadays we have those oxygen concentrators and many other devices that are linked with those checking your oxygen levels, those oxygen checking instruments and so on. So we have those remote monitoring devices with us, especially in the urban areas. And it's important to understand that workstations and workspaces need to be built for the healthcare workers to conduct those remote sessions. And there are telemedicine cards that are being provided, that they are the AMD Global Telemedicines. They provide those all-in-one hardware and software requirements. Now, this is one of the example. Many of the companies and many of the solutions are being provided. Number of companies are working towards developing workstations and workspaces for better telemedicine development environments. Then obviously video conferencing softwares are required for better environments, and those which have a very easy infrastructure, because when we are talking about people, because when you talk about health of the people of 60-65 plus, my father, my mother nowadays not very adapted to those video conferencing and teleconferencing. So better solutions, easier solutions, just one click solutions need to be provided. We have those nowadays, we have those go-to meetings, and we have those WebEx meetings, and we have those Zoom meetings. So one touch solutions, these need to be provided for better video conferencing solutions. Obviously those who have better clarity, better connectivity. I know that network issues are there and other issues are also there, but we need to understand those solutions need to be built, those solutions need to be found out in order to build a better, healthier environment for Indian perspective. And when we are talking about remote patient assessment and monitoring softwares, it's important to understand that various types of computer feedback, those blood pressure monitorings, obviously those there's remote patient monitoring need to be assessed at a very, very easier and a healthier manner. So when we talk about the CBS Health, so this is one of the solutions that is being, just a sec, it went there. So there is a CBS solutions, and the CBS solutions that is being developed by the Cambridge Brain Science. It is a secure and powerful cognitive solutions that is developed by the healthcare practitioners. Very, very easy to use. Maybe I'll be showing you one of the functioning or working of that CBS Health. Maybe tomorrow, I have a session tomorrow also, because I'll be focusing more on telehome, and I'll be focusing more on the concept of AI and artificial intelligence coming into the picture, because we have a lot of computer softwares, people also connected to telemedicines and telehealth. So this is again a very, very easy environment that is being built by the Cambridge Brain Solutions, and they provide a web-based tool which is very easy to generate reports, very easy to connect to the people in terms of telemedicine environment. Then we have another solution, that is the 100 Plus. This is again a remote monitoring platform and no cost to providers or patients. There's a portal and a window opens, and information such as blood pressure, weight, and blood glucose level being entered, and then you have a lot of information being entered, and it's again a business model that is being offered. Then Bina.ai. The important with Bina.ai that I found is it is now linked with a lot of artificial intelligence algorithms, and it has a lot of biometric data. And there's a smartphone cameras, and we're claim to able to take this heart rate, oxygen saturation levels, and it's better because it is going with those predictive analysis also, those artificial intelligence algorithms also, and it's important that it's being specified that it implement telemedicine without the need to ship those additional equipments to the patients, because Bina.ai is again a very, very good tool for with the artificial intelligence algorithms. Then Coach Care, again there's a virtual health and remote patient monitoring system, and Coach Care provides monitoring of the patients at home, and it's focused on increasing the revenue and lowering the cost of the care services, and it's working with those reimbursement and insurance that are being done, so it work on that also. And then we have the Vivify Healthcare. This is again a management system and post-acute care program. After the patient goes from the hospitals, then their post program is also there. So this is a very, very adapted environment. So Pathway pulls data from patient wherever they are coming, and through their mobile phones and the remote monitoring kit, and they have, this is shown in the picture also, and it works very, very healthier environment in many of the hospitals and other telemedicine centers. Then we have the on-demand virtual healthcare portals. These are also becoming very familiar, and they are also adopted by the people in terms of eye clinic, times of eye. There's a small eye clinic, which is a virtual hospital. We have those medical advices, diagnosis. Then we have the MD Live. MD Live has an experience board of those clinicians and special people, especially for the mental health care. In this COVID-19 pandemic also, we saw a lot of people suffering from a lot of healthcare issues. Then we have the Teladoc. Teladoc is also regarding to those dermatology, those mental health, and in terms of connecting with the relevant healthcare professionals. So these are some of the on-demand virtual, some top I'm talking about, but there are a lot of other also into the market which are working for the betterment of the people. So let's check this small video.
One of my personal goals is to care for people that don't have access to the same care that you or I do. Patients in nursing homes or skilled nursing facilities, the baby boomers, there's more and more patients we need to take care of, and some of them just can't get to their doctor. For patients in our community who don't have health insurance, that patient has to take a day off from work, take 3 buses to get to the hospital, and then there's no specialist at the hospital. Telehealth is a way to bring the expertise of an expert to the non-expert. For example, if you're a patient in a rural community, your doctor in that community would take a photograph of your skin, send it to me over the internet, and I would give my advice back after I review that information. So if telehealth is implemented widely, patients would have the best care possible with a limited number of specialists and for the lowest cost to the healthcare system.
Lowest burden on the healthcare system. So this I am ending on a very positive note, and this is Dr. Shireen Zafar, and I have a session tomorrow also, so we'll be connected with more of AI, machine learning, with more of tele-home monitoring, with more of devices being connected in terms of telemedicine environment. But these are some of my mail IDs. You can connect to me, and some of my Google papers you can check in the Google Scholar, Scopus, and Mendeley also. And now I'm open to the questions, and I would like to interact with the participants in a very, very open box manner, because as I told you, the box need to be open every time.
Ma'am, it was a very wonderful session, and you have covered various important points. As this topic comes with a lot of opportunities and also along with a lot of challenges, during the time of pandemic, it definitely have a future scope we associate with her technologies. Ma'am, there are certain queries which are raised with by the participants. Yes. Shall I come through these queries?
Yes, ma'am. Yes, sure. Because I ended a little bit earlier, because now I want to interact with the participants, and because, ma'am, this is a learning session for everybody, not only for the participants, for us also, because now the PPT ends, and now the interactivity and collaborative work will help a lot, because I have learned from the past 1 year giving those FDPs and sessions that we have done a lot of collaborative work in different fields, whether it's the telemedicine, whether it's machine learning, artificial intelligence, with the connectivity of the people, because various sectors need to be bounded together for better solutions.
Yes, ma'am. So, ma'am, I'm just proceeding towards the questions which has been asked by the participants. So, ma'am, there is one of the participant, Artigen, who has asked about the telemedicine for we faculties, and how, where, and when the faculties can get involved in this technology. This is the question raised by Artigen.
I want to tell it needs to be started from scratch. Okay, so if the faculties are not you need to check out which field you are belonging to. Okay, if suppose you are a pharmacy people, or you are from a healthcare environment, or you are from an IT environment, because I am myself from the IT environment, so I prefer more of going towards those predictive analysis, more connected to the machine learning environments, getting those health records. And now these works need to be confined assigned to the 3 environment, because for me getting the data is very difficult. Okay, but for me analysis of the data is easier. So this should be a round table work, because now I have my collaborators in the hospitals who provide me that sensitive data, and I take the authenticity that I will not leak that data, I will not harm that data. So, and then I provide them the reports, then I provide them those artificial intelligence solutions, those predictive analysis. So if you need to start from the scratch, you need to first find out which field you are belonging to. So if you want to connect to the telemedicine environment, it's better to connect to the Indian. As I told you, this online OPD, that is the e-Sanjeevani OPD, is built by the IIT students only, ma'am. And lot of computer science students and lot of other people are being involved. And ma'am, in my tomorrow sessions, I'll be showing the 12 Indian top class startups that are being started in COVID-19 pandemic scenario, and all by the Indian IIT students. So not only IIT students, the T-Hub incubator, because a lot of South people are connected in these participants also. So the T-Hub incubator people, the Bangalore people, the Delhi people, not only IITs, I don't want to specify, there is vast work done by different. So first is find out your field, because jumping into a telemedicine environment requires a field specification. Because if you are in IT, first go towards your scenario. If you are a telemedicine, you cannot directly go to machine learning. Healthcare workers, they cannot learn toward machine learning. So they need to find out their solution. That's first thing you need to track out.
Ma'am, regarding the e-Sanjeevani, as you have told, there is one more question. The participant has asked, how will the patient pay his or her consultation fees through e-Sanjeevani?
This is free. This is free from the Indian government, yes.
And it's really very good for they are providing the free services.
Yes, ma'am. And this is around 1 million people have got consultation from last year till now. So this is free. This is no money involved here.
Yes.
Obviously, ma'am, if there are issues which are more complicated, then although we have those different platforms, but for consultation for minor issues, it is very, very helpful.
Ma'am, next question is, how panel of doctors are connected with the telemedicine, and will telemedicine affect the business economy of hospitals?
No, ma'am, not at all. Because I can tell you, telemedicine is getting it's making its own economy. Okay, now one thing is that many of these, as I told you, Practo, 1mg, ma'am, a Delhi-based company, and we in Jamia Hamdard call that young boy, just a young boy of 27 and 28 years old, and he gave a very good presentation in our university. And he at that time, me myself was not agreeing with that 1mg, because getting those pharmacies from the direct online and connecting to the doctor, it was 2 to 3 years back. But now I am a 1mg customer. Every day I am getting something or other thing from 1mg. Even ma'am, even those Bonvitas or those Pediasures I am getting from my son, because it is so easier, it is so advantageous. So the thing is that they connect to the doctors. They have those online digital libraries that is being provided by the Indian government. They connect to the doctors. Doctors give them their consent, because as I told you, ma'am, in India there is huge this workforce is coming out. They require some job, they require some benefit, because in India, as I can tell you, there is crores of money spent for making a person doctor, in terms of when you're talking about private colleges. So that money is now being paid by those, and they are paying a very healthy amount of money. And what is saving? Your conveyance is saving. You're not going anywhere, and you're connecting to 5 to 6 apps, and you are earning money. So what more than that, ma'am?
Okay. Thank you, ma'am. There is another one question. How to solve an infrastructure problem with respect to service availability, and what are the securities measures we have to consider?
Ma'am, infrastructure is little bit a government issue, very, very important. But what the thing is that we need to specify is that in Delhi, a lot of those mohalla clinics I have seen have been established. If there is a setup, the Delhi government has set up those mohalla clinics. So what as IT professionals government can do, there only they can develop those telemedicine centers, because you have that infrastructure, you have that setup. What the thing is required, a better video conferencing software, a telemedicine person, or a person IT expert. So as I told you, those BTech final year students, those BTech pass out students should be nurtured in that workforce. Okay, and if you say that we cannot help a person every, so you can allot that person 10 sites, 10 mohalla clinics, because the infrastructure is there. So these things need to be think upon, and we have a very, very healthy thinking workforce. New ideas, new methodologies, new solutions need to be provided. And I think this telemed, as I showed you a video, it required only one to two room setup. Obviously, for example, if you're going with very specific so example eye setup or something like that, then that setup is required. But for telemedicine environment, you can connect to the doctors, you can tell them the issues. So 1 or 2 room setup is required. So that's important to be nurtured and think about.
Okay. There is another question. In rural and semi-urban area, the patients are not satisfied until the doctors physically examine them. They still don't have a faith in the telemedicine. How we can aware them about the telemedicine and telehealth is as effective the physical therapy?
And this is all of trust and reliability. As I told you that I was not trusting 1mg. I'm like living in Delhi. I am working IT professional. I know everything about, but I was not trusting. But it is of use and trust and reliability. As I told in all my PPT, the box was closed. Now, if the box is open, let the things come out. Even if they are negative, let them come out. Let the people make use of that. If we say that, no, I'll not go for online teaching, then 1 year, the whole teaching was wasted. If you say that, no, we'll not go for online teaching, we want a blackboard to teach, we want a duster, as many of the people say, we want that chalk smell. So if these things were being specified, 1 year total wastage of the students was done. But we have adopted it. Similarly, at the most important thing for villagers is need to be done. Many of the village people have very, very big houses. Okay, so there those centers could be set up. The thing is that network, for Indian perspective, network coverage is an issue. So the area where their network is much better, maybe the starting where the village starts, where it is connected to the boundary of the urban area, their setup could be done, because village people have those walking capabilities. 2-3 kilometers is not an issue, so they can walk and come there. So once the trust is being built, everybody will use that.
Yes. Ma'am, any job opportunity to the student like B Pharma and D Pharma?
Many job opportunities, ma'am. I'm telling you, as I told you, these online nowadays, we have those Practo, we have those 1mgs and many apps. What they are looking for, they are looking for pharmacy people, they are looking for doctors. So just apply. Even on LinkedIn also, there are a lot of opportunities for telemedicine, because many of the people are building their apps, they are connected to the government portals. And nowadays government in terms of its these schemes of various types of Unnat Bharat schemes and various types of other schemes, they are asking the people to come forward, because many a times you are not coming forward. So you need to check regularly, update. And what I can do tomorrow, I'll bring some links which have the direct connectivity to those government jobs and various types of other types of jobs. I'll bring those links tomorrow also.
There is a question or another question. Any diploma courses are available to study the program?
Ma'am, it's specifically that nowadays government hasn't started some specific diploma courses, but with Delhi universities there are very good courses, the graduating courses, which are not only for the for example, if you've done a bio in 12th, you can go for those dietitian, very important nowadays. Each one of it's very concerned about its health, so those Healthify apps, they consult to a dietitian. So these are some of the courses that Delhi University offer, and with the and Delhi University has the advantage, only 5,000 and 6,000 yearly fees you give. So if you get your admission of a student in Delhi University, you are so easy with that cost being spent on your studies. So very good courses are being provided by Jamia Hamdard also, our university. They are providing pharmacy, very sub courses, not only bachelor in pharmacy, various type of optotherapy courses, very type of instrument courses, working on those instruments. So there are some diploma courses also. You can go to the website of jamiahamdard.edu, and even Jamia Millia Islamia, Delhi University, they're offering, because nowadays people thinking is coming out of those doctors and engineers. They are going for very skilled courses. So very good courses are being provided by various government and our institutions also. So you can look into those websites and go for that. And if any help, my numbers are with the organizers. You can connect me also.
Thank you, ma'am. You have shared a lot of information with our participant. There is one more question, participant. If you want, if you allow me, then I shall ask.
Yes, ma'am. Sure, no issues.
How the X-ray and CT scan can be handled in the telemedicine?
Ma'am, I know there are some, as I told you, some of those apps which I told in my PPT, they provide the whole kit. Okay, so there's a whole kit of the, you can wear that kit, and that X-ray can be done, and live also can be shown to the doctors. But for Indian perspective, this is little bit to be more nurtured. Okay, this is a little unfamiliar for Indian perspective, but many of the countries in USA and many of these healthcare providers and service providers of telemedicine providers, they are providing that whole kit depending upon your issue. So if you require regular X-ray to be done, if you require regular sensing to be done, many of the artificial intelligence and machine learning kits have been utilized. I'll show in my tomorrow PPT also. A lot of work is done with AI and machine learning also. That is very helpful in the telemedicine environment. That's why I am giving a lecture here, because I am connected with AI and machine learning, and I'm very much connected with telemedicine environment, where a lot of, because ma'am, as I told you, nothing could be complete if you have two fingers joined together. IT and health need to be go on in order to get better solutions.
Participants are continuously sending the queries, ma'am. There is one more question. What is the role of AI in machine learning in the telemedicine?
That, ma'am, I told you, and tomorrow I'll be bringing many of the tools which people can adopt, even their Tableau tool. If you say that I don't like coding, there are a number of tools with the Jupiters and other. I'll be bringing in tomorrow. We have an extensive discussion in the tomorrow session with the telehome and even the artificial intelligence and machine learning. So don't miss tomorrow's session. I'll be giving you a brief and very extensive discussion on AI and ML.
One more query. We can develop an app and we can monitor doctors. It is possible.
Ma'am, actually, there are guidelines by the Indian government with the telemedicine usage. So just directly developing an app and going into the market is not the solution. There are some guidelines that need to be followed, and in order to follow these guidelines, you have to specify what the Indian government specify. Because, ma'am, actually, this is the health, and this is the situation of living and dying. So you need to follow some solutions. You need to follow those rules. Obviously, when it get verified, when it get registered, when it get authenticated by the Indian government, you can start using that.
Ma'am, it is very wonderful session which is given by you. You have given the deep insight about the each and every topic. So ma'am, thank you so much on behalf of everyone. I will request that participants should fill their feedback form and for the queries. Thank you, participants. You have also equally made this lecture with a full of enthusiasm.
And you can share the PPT also if the participants require.
Yes, ma'am. Please do. Please do.
No, I have shared with Rakesh, sir. You can further share to the participants also.
Yes, sir. Thank you, ma'am. So it's a small break of 15 minutes, and let's continue with another session which will begin at 12:30 p.m. With the next lecture with the next resource person. Thank you so much, ma'am. With this, and at the very short notice, you are here. Thank you once again.
Thank you, ma'am. And I said, "Kabhi alvida na kehna." I'll be meeting tomorrow, and we'll have a good discussion tomorrow.
Yeah. Yes, ma'am. Yes, ma'am. We will sure. Thank you, Rakesh sir. Rakesh sir, over to you.
Okay, ma'am. Thank you, ma'am. Dear participants, you are requested to, there is feedback and attendance link here in the chat box. If anyone that is got disconnected, that he can ask for the attendance and feedback link, you will get that. And we will rejoin at 12:30. Next session, second session will start at 12:30. And please join 10 minutes before for the smooth conduction of the session. Okay, thank you. Thanks. Ma'am, 1 minute, please.
Yes.
Yeah. Varsha ma'am, that is recording that started now. Please introduce that is not inside the recording. Please introduce, ma'am.
Okay. I'm start again. Good afternoon. Welcome back once again to the 7th session of our FDP. I especially welcome our next resource person, Dr. Preeti Maheshwari, whose topic, Introduction to Internet of Things. Before moving towards our lecture, let me introduce Dr. Preeti Maheshwari. Dr. Preeti Maheshwari, currently working as a state academic consultant for Department of Technical Education and Skill Development. She has a vast experience in computer science and engineering, higher education and training. She involved in various software projects and associated with the roles of teaching, research and administrative work. She has a various number of a national and international paper publication and also book chapters too. Over to you, ma'am.
Thank you, Varsha ma'am.
Thank you, ma'am.
Thank you, Rakesh sir, for introducing me in this workshop at FDP. Let me start my presentation.
Yes,
that is Introduction to IoT.
Yes.
Is my screen is visible to all of you?
Yes, ma'am.
Okay. A very good afternoon to one and all. I'm Dr. Preeti Maheshwari, presently working as a nodal officer and former professor of Rabindranath Tagore University. My today's topic is Introduction to Internet of Things. As we all know that I want to start with Albert Einstein's quote, if you can't explain it simply, you don't understand it well enough. So with this, I want to say, if I cannot explain you Internet of Things simply, then it is difficult for you to understand it as per my understanding. So let us start now. I want to start with a short video of how life is simplified with Internet of Things. Let's watch this. Sorry.
Excuse me, ma'am. Video no sound is there.
No sound is there.
Yeah, please share your screen, and in the when you will share your screen, at that time you will find a checkbox there for the audio.
Share sound. Okay, right.
First answer, ma'am. First answer. Yeah, sure. Voice is coming, ma'am.
So this is the common day of a common man with the help of technology. And the technology makes everyone so happy and so free from responsibilities so that they can figure out their day enjoyably. So the outline of today's presentation is what is IoT, understanding of IoT, where IoT is used, IoT architecture, the technologies that are used in IoT, what are the various applications of IoT, and as this FDP is on telemedicine and healthcare, so IoT in healthcare and what are the various challenges in it. So we all know that the official definition of Internet of Things is the network of physical objects, devices, vehicles, buildings, and other items embedded with electronic software sensors and network connectivity that enables these objects to collect and exchange data. This term, Internet of Things, is first coined by Kevin Ashton. He described it as a system where the internet is connected to the physical world via ubiquitous sensors. So, Internet of Things comprises of physical objects that are not exactly connected before this technology. As we know that things can be a pump, a utility meter, or a car engine that are not exactly connected previously. So they are now connected with IoT revolution, and then they has the capability to connect to the internet and submit the data for further prediction or analysis of those data. So the scope of IoT is not limited to just connecting things to the internet, but it also allows these things to communicate and exchange data so that that can be processed and the machines and applications achieve their goals. So is it an evolution or a revolution? As we all know, evolution is when something is changing from its previous structure to new structure. But revolution means when it totally turns around, a sudden complete formation of new change. So in this example, as we see that earlier carriages are there, they are evolutionized with more fancy carriages. But revolution is when there is an engine in these carriages and it becomes automobile. As well as we have analog phones, then we have fancy analog phones also. But now it is a revolution that we have a smart internet phones with us and we can do everything in our palm. So the evolution of Internet of Things start before pre-internet era when there is only a fixed phone lines or a mobile phones which have the telephony with SMS and all. After that, Internet of Content is coming when communication is possible using network for email, information, and entertainment. After that, the new era will come with Web 2.0 as Internet as a service. So we have business-to-business communications and e-productivity, e-commerce is there. We have smart IT platforms which can communicate where we can pay online. Then we have Internet of People afterwards. This is a social media generation where we have Skype, Facebook, Telegram, chat, smart chat, so many things. Then there is an evolution of Internet of Things where machine can talk to machines. Machine identify themselves, monitor themselves, meter themselves. They are automated. The payments can be done. They can repair themselves. These are the things which are possible in this era of Internet of Things. So understanding the IoT, there are majorly three perspectives. First one is Internet of Things. So first part is Internet. So internet deals with communication between devices, systems, and users. Then we have the second perspective as things. So these things can be anything, any physical object which is ready to communicate on the internet for further processing. This can be a RFID, this can be a smart card on your automobile, this can be a smart pump, smart refrigerator, anything like that. These are the physical objects that are connected. After that, how this communication is possible. So the third perspective is engineering aspects of these communication lines. How these things are communicated from the physical network to the internet and then analyze and then perform the various activities for that they are made for, like mining of data, security of your systems, semantics discoveries, etc. So this Internet of Things is known with various names like machine to machine, that is M2M communication. Cisco give a name Internet of Everything, which is coined nowadays very much. Bruce Schneier gives this a name of world-size web. In the Terminator movie, we have seen it as a Skynet. So where is IoT? IoT is everywhere. Now in your life, it is everywhere. You have a smart watch, you have a smart phone, you have a smart fridge, you have a smart healthcare. You are using IoT everywhere. Now, person is connected with motion sensors in boots, motion sensor and other sensors in wristwatch for ECG, EEGs, blood pressure, pulsometer, which is right now, oximeter is the very important device for all of us in this COVID-19 period. We have to continuously watch our oxygen, and all these things are connected and able to give us the information and the analysis. Let me show you one more video related to this.
The Internet of Things is changing much about the world we live in, from the way we drive to how we make purchases, and even how we get energy for our homes. Sophisticated sensors and chips are embedded in the physical things that surround us, each transmitting valuable data that lets us better understand how these things work and work together. But how exactly do all these devices share such large quantities of data, and how do we put that information to work? Whether we're improving the production of a factory, giving city residents real-time updates on where to park, or monitoring our personal health, it's the common Internet of Things platform that brings this diverse information together and provides the common language for the devices and apps to communicate with each other. The process starts with the devices themselves, which securely communicate with an Internet of Things platform. This platform integrates the data from many devices and applies analytics to share the most valuable data with applications that address industry-specific needs. Let's start with a simple example, a car. After taking a long road trip, Rebecca notices that her check engine light has come on. She knows that she needs to have her car looked at by a mechanic, but is not sure whether it's something minor or something that needs immediate attention. As it turns out, the sensor that triggered Rebecca's check engine light monitors the pressure in her brake line. This sensor is one of many monitoring processes throughout the car, which are constantly communicating with each other. A component in the car called the diagnostic bus gathers the data from all these sensors, then passes it to a gateway in the car. The gateway integrates and sorts the data from the sensors. This way, only the most relevant diagnostic information will be transmitted to the manufacturer's platform. But before sending this organized data, the car's gateway and platform must first register with each other and confirm a secure communication. The platform is constantly gathering and storing thousands of bits of information from Rebecca's car and hundreds of thousands of cars like hers, building an historical record in a secure database. The manufacturer has added rules and logic to the platform. So when Rebecca's car sends a signal that her brake fluid has dropped below a recommended level, the platform triggers an alert in her car. The manufacturer also uses the platform to create and manage applications that solve specific issues. In this case, the manufacturer can deploy an application on the platform called the Asset. asset management system. This application oversees all of their customers' cars on the road, as well as all the parts in their warehouses. It uses the data from Rebecca's car to offer her a potential appointment time to service her car, directions to the nearest certified dealer, and a coupon for the service. What's more, the app will ensure that Rebecca's brakes are covered under her warranty, that the correct replacement part is ordered, and then sent to the dealership so it is ready when she arrives. But the manufacturer's analysis does not stop there. They have also deployed a continuous engineering application that tracks not only Rebecca's car, but hundreds of thousands of others, looking for ways to improve the design and manufacturing process of the car itself. If the same problem in her brake line crops up in a critical number of other cars, the manufacturer uses applications custom built for the automobile industry to pinpoint the exact problem. They can see if these cars were made at the same factory, used the same parts, or came off the assembly line on the same day. So what do all these pieces add up to? Streamlined inventory management for the dealer, a better, safer car from the manufacturer. And for Rebecca, it means she can be back on the road faster and get to where she's going safely. All thanks to the Internet of Things.
So, as we know that it is growing, IoT market is growing. In 2015, we have 15.41 billion connected devices. Presently, we are around 35.82 billion devices that are connected. And in the near future, almost in 2025, we have 75.44 billion machines are connected. And from the NASCOM itself, the 9 upcoming fields in computer science and IT, we have IoT as one of the major market share for job also. So with this, we can understand that IoT is helping to reduce cost to our products. It is also generating new revenue stream for the market. It can improve performance of the products and it create innovative services. So we have various opportunities in this Internet of Things world. Like for consumers, we have smart home control systems, optimized energy use, maintenance. For the retail market, we have product tracking, inventory control, focused marketing tools. For medical, we have wearable devices, implanted devices, telehealth services. For military, there are so many applications are available like resource allocation, threat analysis, troop monitoring, because military is the major user of IoT since 15 years. In industrial also, we have smart meters, wearing out sensing, manufacturing control, climate control. In automotive, in the last video also, we have seen that everything is possible for the maintenance of a vehicle, to maintain the inventory, to maintain the other parts of automotive sectors. For environment, we can do weather prediction, which we are right now doing in all our major smart cities in India. We are doing resource management presently. And in agriculture, there is a crop management, soil analysis, disease detection in agriculture. There are so many applications which are possible. And now agriculture is the major sector which are using IoT. So if there is no IoT, what is the life before and after that? Let us just check it out. So the architecture, just a minute. Huh? Yes. So the architecture, IoT has its different architecture, like our computer network architecture or software architecture. So we have here also 7 layers. We have physical devices that are sending the data. Then we have a connectivity or communication units to send this data. Then we have edge computing units like data element analysis and transformation part. Then we can store the data or accumulate this data in the storage form. Then this data is aggregated and accessed by the programmers to do the further analysis. And then at the next layer, that is the application layer, we have reporting, analytics, control, etc. Finally, we have a business process or collaboration of process from where this data can be used and these reports can be used. This is the common architecture which is used. Initially, if you go through with some research papers on IoT and all, so it will show 4-layer architecture where the systems are there, then connection network is there, storage is there, and the application part. So on the same way, it is the 7-layer architecture of IoT. Now, IoT involved various hardware devices, communication technologies, protocols for IoT, software, that is IDEs, for IoT, cloud platform, and operating system for IoT, right? So let us go through these things individually. For the hardware devices, the most important thing is microcontrollers. In the market, presently, we have so many microcontrollers, and some of them are Node MCU is there, Arduino is there, Raspberry Pi, Intel, Edison, ST, and many more are coming in the market. For the sensors, we have different kind of sensors available with which we want to take the information. In our device, if we want to go for a weather monitoring system, then definitely what we require is we need a temperature and humidity sensor. Then we need oxygen level or carbon monoxide sensor, carbon dioxide sensor. So these sensors are attached together with the microcontroller and they are able to communicate with the network using communication gateways, right? And if we want to make a healthcare system, then what we want to analyze, like we want to analyze the heartbeat or oxygen. So we will use that kind of sensor. Then the other important part of IoT technology is the communication technology. Whether we are using the telephone network, that is GPS, 2G, 3G, GPRS, GSM, LTE network, or we are using other networks like Zigbee, Bluetooth, LoRaWAN. So these are the network which are used in the networking gateways, not the satellite or telephone network, but our initial network. And some personal network are also there, like EnoClean, WiMAX, etc. Now, for communicating between the network and the device, what you require is protocols. Protocols that help us to communicate fast and give us our responses faster. So there are four major protocols which are involved in it. First is COAP, that is Constrained Application Protocol. Second is MQTT, that is Message Queue Telemetry Transport. Third is REST APIs, and fourth is Extensible Messaging and Presence Protocols. So how COAP works? COAP works with its own server and client network, and then it communicates to the internet through HTTP communication and transfer the data. This is the basic structure of COAP. How this MQTT protocol works is it will take the sensor information, then go to the MQTT broker, and then send it to the API builders or SQL database, or then it will send all the information to the computer or a mobile device, whatever you make, like a web page or a package or a application for mobile. REST APIs are also used to communicate between these devices in the local area networks. Then they communicate to the other devices where we have to finalize the reports and give the output of our information. Then we have XMPP server and clients, and it will also communicate with the XMPP architecture, and it will send the information to all the other devices. This is the comparison between the all four. This is the comparison. In COAP, devices may sleep, but not 95% of the time. So they are continuously taking the electricity to be on and to transfer the data. And let's take an example of weather monitoring system. For weather monitoring system, we have an app in our phone, like we are getting information after every hour. So if there are weathering sensors which are attached to the device and they are continuously taking the electricity, it will definitely usage of electricity and consumption is far, far greater. So it is important that we should minimize the use of electricity, minimize the use of device, because these devices are also very sensitive. They are very much fragile. So we have to use them only at that particular of time when we require them to send the data to us. That's all. Why to continuously on them and continuously transferring the data after every minute or after every half an hour, when we require it only after a 2 or 3 hour of interval time? Then the second one, MQTT, is where it is possible that pretty much the same as MQTT, but will really sleepy devices. They have the potential of 10x more devices comparing to old MQTT, and they have traversal become a larger issue here comparing to MQTT. So must be addressed during the planning stage, which protocol you want to use. The COAP is pretty similar to MQTT's choice, but with several additions. Web services oriented architecture rather than messaging oriented. When you are building a platform for the open development communication in the internet space, if you want to send the SMS or you are using the mobile network, then COAP is not usable, not allowable, you can say. For REST APIs, one may communicate from device to the cloud. NAT traversal around the globe is among the top priorities. No specific limitation for the traffic. Plus, devices themselves are not very resource constrained. Device cloud for the open development community is available, like Device Hive. Home office, CP, and good WAN connection is required to use the REST APIs. XMMP is real-time massive scalability nodes. When you can use more than 1 lakh nodes at a time, you can use XMPP. When messaging traffic is large and potentially complicated per device, when extra security is required, public untrusted environments, strict authentication and authorizations are preferred. This is the most preferred protocol when you are using IoT in large applications with large number of devices. So communication with these protocols then go for a gateway, and then they have a remote gateway for these individual information, right? So we can use Zigbee for it. We can use LoRaWAN for it. In Zigbee, IoT devices are communicated through Zigbee, and then they will send the information to the cloud. In LoRaWAN, we have more, we can say electricity consumption is less. LoRaWAN has low pass, so everything can be sent immediately with small size chunks, and thus the communication is faster in LoRaWAN as compared to Zigbee. We have different development platforms also, that is softwares for IoT. Like we have, if we are using Arduino boards, then we have Arduino IDs. We have Python IDs, Eclipse IoT is also there. And these all, if we go for an Eclipse ID in Linux or Windows, we have a development stage, optimization is possible, debugging is possible, SDK management is possible. So for the development, you can use any language like C, C++, Python, U-boot, config, etc. For debugging, you can use target management or remote debugging. For optimization of code and your data, you can use memory analysis, tracing, profiling, code coverage. SDK management is also possible with this IDE. Now, when we are using some IDs, we have what we have used till this time in IoT is we have used devices, that is microcontrollers and sensors, to send the information on the network. Then we understand how to send the information to the server for further processing. Now, we are into the cloud computing stage where these information stored and processed using cloud. So I think that many of you are very much known about cloud computing, that what we can do with these cloud. So let us have a look on how cloud work.
You have big ideas to streamline your business and drive sales through the roof. But to get there, your ideas need business apps. And business apps have always been too expensive, especially in times like these. Behind each one is a world of complexity. They need a data center with office space, power, cooling, bandwidth, networks, servers, and storage. A complicated software stack, and a team of experts to install, configure, and run them. You need development, testing, staging, production, and failover environments. And when there's a problem, good luck. You call technical support, and they don't know, so they blame someone else. Oh, and when new versions come out, you would upgrade, but that might bring the whole system down. Now, this is for one app. When you multiply these headaches across dozens or hundreds of apps, it's easy to see why the biggest companies with the best IT departments aren't getting the apps they need. Small businesses don't have a chance. Cloud computing is a better way to run your business. Instead of running your apps yourself, they run on a shared data center. You just plug in, like a utility. This makes it fast to get started and it costs less. It's like Gmail compared to Microsoft Exchange. With Gmail, do you need servers and storage? No. Do you need a technical team to keep it up and running? No. Do you have to do upgrades? No. When you use any app that runs in the cloud, you just log in, customize it, and start using it. That's the power of cloud computing. This model is so much better, it's changing the way we think about software. Not just for consumer apps, it's also being used for business apps. We call this enterprise cloud computing. Businesses are running all kinds of apps in the cloud these days, including custom-built apps. Why? Because you can be up and running in a few days, which is unheard of with traditional business software. They cost less because you don't need to pay for all the people, products, and facilities to run them. And it turns out they're more scalable, more secure, and are more reliable than the vast majority of apps out there. Here's why. They're based on an architecture called multi-tenancy. With a multi-tenant app, there isn't a copy of the app for each business that's using it. It's one app that everyone shares. But it's flexible enough for everyone to customize for their specific needs. It's like a giant office building where everyone shares the infrastructure and services, like security, yet each business can customize their own office space. This means apps are elastic. They can scale up to tens of thousands of users or down to only a few. Upgrades are taken care of for you, so your apps get security and performance enhancements and new features automatically. Now, the way you pay for cloud apps is also different. Forget about buying servers and software. When your apps run in the cloud, you don't buy anything at all. It's all rolled up into a predictable monthly subscription, so you only pay for what you use. Finally, cloud apps don't eat up your valuable IT resources, so your CFO will love it. And you can focus on projects that really impact the business, like deploying more apps. Cloud computing is a simple idea, but it can have a huge impact on your bottom line. For more information, go to Salesforce.
Now, there are different operating systems also for the IoT. Operating systems specially designed for IoT devices based on architecture, scheduling method, networking technology, programming models, power, and memory management methods. So there are some operating systems which I find is Contiki, TinyOS, RIoT, NanoRK, LightOS, Mantis OS, SOS, RedOS, etc. Now, how these all things work together? We have sensors, actuators, then we have device, microcontrollers, then we have gateway, then we have cloud where we make our application and deploy it to a website or app. Now, applications of IoT. We know that there are various domains in which applications of IoT are there, like home, cities, environment, energy systems, retail, logistics, industry, agriculture, health, and lifestyle. So first, let's take an example of smart homes. Initially, we have seen in our first video that is a smart home application where every appliance is connected. Intrusion detection is possible, smoke gas detector is possible, lighting are also smart. So what we can do with our smart home application? We have smart doors, we have security systems, we have smart air conditioner, lighting control system, energy management, appliance control, smart thermometer, smart bathroom appliances, and garage door opener also. So we can make our life better with using smart home application. In India nowadays, it is possible, but to some extent. For the IoT application, now we know that major of our smart cities are converting to smart cities. So they are using smart parking, smart lighting for roads, structural health monitoring, surveillance, emergency response. Though these things are very initial stage now, presently. As for smart parking, we are not having the exact parking space to be monitored, to be available for the driver, but we are into it. We are trying to implement all these things. We have smart garbage collections, smart pupil monitoring or mass monitoring, smart light also in our smart cities. This is the scenario of garbage collection where you have small garbage cans that are connected with smart pole, and with that they are communicating to the cloud platform. While the large garbage cans with active sensors can directly connect to the servers, and they will respond to their nearby garbage truck also that they are full and you can collect the garbage from them. And these garbage or the various things that can be collected can be transferred to recycling plant or other plants also. Smart garbage can like this are very much available in European countries. We have IoT application for smart environment like weather monitoring, air pollution monitoring, noise pollution monitoring. Forest fire detection is a major concern nowadays as we have a forest fire in Uttarakhand. River flood detection is also required, but research is going on, but not yet any proper river flood detection technique is available. We have Raspberry Pi based weather stations which can inform about temperature, humidity, air pressure, night levels, UV levels, carbon monoxide, nitrogen dioxide, and smoke level to the internet. This is also implemented in Rabindranath Tagore University also. And we are having a smart environment monitoring system at the university and smart garbage collection also in the university. We have smart poles to communicate and to collect the informations. We have then the other kind of application is IoT application for smart energy system. Everyone knows about the smart grid, renewable energy system and prognosis. How smart grid will work, we can see in this example, like we have different kind of energy generation plants like hydraulic power generation, photovoltaic generation, thermal power plant, or nuclear power plant. All these plants will generate the electricity or wind generator plant. Then they stored information, they stored the electricity in the smart grid, and depending upon the requirement of different utilities like homes, factories, cities, offices, or electrical vehicle, this electricity can be given to the concerned users. So this is the basic concept of a smart grid. We have to collect energy from all the parts and then distribute them to the users. IoT in agriculture is also very smart work, and it is based on precision farming, that is plant and soil monitoring. Agriculture drones are used to for the pesticides. Smart greenhouses are there, autonomous and robotic labor is there, and this IoT in smart agriculture is also implemented in RNTU IoT lab, where they monitor greenhouses as well as 8 acres of land of agriculture there, and they are seeing the crop disease detection is also possible, so they are using it. Then we have a smart gardening. We have small devices which are there for our in-house gardening part, bedponics kind of a smart gardening where we can have the soil moisture level or light levels of our plants and we can detect everything from them. Then IoT in industry is another part which is very important and which is used. Let's have a look on this.
This is Jim. He is a manufacturer and owns a manufacturing plant. His plant has many things at one place, such as a supply chain and chain in the back office. All these things generate lots and lots of data, like transactional data, ERP data, CRM data, and public data. These are all the things together which empower and enable his employees to connect with customers and business partners. Now, even though Jim's factory looks well equipped, he still faces several challenges. During the production process, machines stop working frequently without any notice. Or sometimes the control system gets many errors at the time of product manufacturing. Even when Jim gets a lot of data, he cannot use it to predict the outcomes he wants. So, what could be the solution for Jim's problems? SoftWeb's IoT solutions are the best option for Jim to overcome these challenges. Whether it's a machine failure, problems in control systems, or getting accurate results from the data, Let's see how these IoT solutions can help Jim and his team. The Internet of Things, IoT, starts with the things installed in the manufacturing plant, the things that matter most to his business. The first step is adding sensors throughout the factory. In this production unit, IoT systems can help in monitoring production flow in real time to eliminate waste and unnecessary work in inventory production with the help of the sensors installed in the conveyor belt. All the data gathered by the sensors is sent to the cloud for analysis and creating predictive models. Not only this, but it will help engineers in implementing condition-based maintenance alerts to eliminate machine downtime and increase output by predicting machine failure. IoT can also help management to manage machines remotely, knowing temperature limits and other settings to save energy and reduce costs. With the collected data from sensors, operations managers can see their production line status and recommend adjustments to manage operational costs using data visualization tools. The R&D department can get insights from the usage patterns of multiple clients and track their equipment failure, enabling Jim's company to re-engineer products for better performance. On the other side, his field service management can identify when to deploy the right resources for predictive maintenance to minimize equipment failures and reduce service costs. With all these solutions, Jim can now tap into data with IoT dashboards and uncover actionable intelligence. He can also modernize how he does his business. IoT is a combination of sensors, cloud infrastructure, data analytics, and visualizations that helps you create a smart manufacturing unit. To know more about how we can help,
Then we have a shampoo plant also, which is automatized with the help of bottle carriers with RFID tags. They can talk to machines in a production line. Then we have a smart dispenser machines that can read RFID info, determine type of shampoo to fill, and knows how much shampoo to fill. Then we have smart labeling machines that read RFID information, determine if the bottle is filled or not, knows what label to put on the filled bottle. This all eliminates the need for human input in the dispensing and labeling process, eliminates the need for separate production line for each type of stem shampoo. This is right now important for us as COVID-19 affects everyone and we need less human input for developing our products. Then there is a facility management services for the machine itself, where the sensors in manufacturing equipment enable condition-based maintenance alert. Like we have a machine and it is in the critical condition. Using the temperature and vibration sensors, we can find out whether the machine is in critical state or not. These IoT sensors can actively monitor machines and send an alert when the equipment deviates from its prescribed parameters. This kind of technology we have also used with RNTU with Aisher, and we make sustainable Aisher generators to maintain the generators of Aisher company itself. Then there are early predictions also in the industrial equipment, where sensors can notify whether your equipment is running with the threshold or not, whether your in generator part, if I can say that whether your diesel is enough or not to run the generator, that can be predicted and that can be used. Then smart inventory management is definitely an important part, where sensors can contain on containers can determine when the product is running low. Employees will be alerted to proactively reorder the parts, and as well as sensors can use to determine if a container is reaching its capacity or not. This is very much used in Best Price and other retail stores. They are using this technology for their inventory management. Then we have smart quality control for our machines and for our products, where RFID attached to products can be used to tag defective products. If over a certain number, an employee can be alerted to see if there is a bad batch of component or if an adjustment needs to be made to the machineries. Employees can be alerted if the problem is the result of defective part. If an adjustment is needed, it can be automatically made in real time. This is the use of smart quality control system. We have different factories which are using these cyber physical production system. so that we have smart operations, smart machines, smart product, logistics, marketing, service, and tools. Let's take an example of Smart Store by Amazon, which is a very good example of inventory and shopping part.
Four years ago, we started to wonder, what would shopping look like if you could walk into a store, grab what you want, and just go? What if we could weave the most advanced machine learning, computer vision, and AI into the very fabric of a store so you never have to wait in line? No lines, no checkouts, no registers. Welcome to Amazon Go. Use the Amazon Go app to enter. Then put away your phone and start shopping. It's really that simple. Take whatever you like. Anything you pick up is automatically added to your virtual cart. If you change your mind about that cupcake, just put it back. Our technology will update your virtual cart automatically. So, how does it work? We used computer vision, deep learning algorithms, and sensor fusion, much like you'd find in self-driving cars. We call it Just Walk Out technology. Once you've got everything you want, you can just go. When you leave, our Just Walk Out technology adds up your virtual cart and charges your Amazon account. Your receipt is sent straight to the app, and you can keep going. Amazon Go. No lines, no checkout. No, seriously.
Now, let us move to IoT in healthcare. So IoT in healthcare is very important. Now it is a very demanding for quality healthcare solutions by people across the globe due to the situations which we are facing, and we need a proper healthcare arrangement for all of us. And these machines should be connected, should give information to our doctors, because we are unable to visit them, and they are also unable to see us personally. So IoT in healthcare is very much important. Now, IoT healthcare sector has started adopting the latest technologies, and they are coming with Internet of Medical Things. And now the market share is increasing from 72.5 US dollar billions to $188.2 billion in 2025. There are so many benefits of IoT in healthcare, like concurrent reporting and monitoring is possible. We are able to do real-time monitoring of patient with the help of connected devices, which can solve serious issues in case of an emergency such as heart attack, asthma, etc. Right now, we are having a Make in India product, which I'm going to show you in the coming slides. And it is very useful. And presently, there are 10,000 devices which we are using in different hospitals in South India to monitor the patient health at their home only, or at hospitals also. But doctors are very much free from these trouble of continuously visiting them in their rooms, or continuously do the video calls, because every information is possible to them. Now, using real-time monitoring of any disease or illness of patient is possible via smart medical device. Definitely, that is linked to medical app on smartphone. So these devices are connected with the patient, doctor, and the network. In short, IoT devices gather and transfer health data, which consists of blood pressure, body temperature, heart rate, oxygen, etc. And now these all devices are connected, and they are continuously, concurrently reporting and monitoring the health of patient to the doctors. Second part is as the data collection and analysis. That is the other benefit of IoT in healthcare, because Long ago, when medical transcription came to USA, they are continuously collecting the data of patients. Doctors, it is compulsory for them to collect the data, to collect all the reports together and give solution to the patient after seeing their history only. This is not yet applicable in Indian scenario, but now it is possible for our doctors also to collect the information and give proper analysis, and they suggest the medications to our patients. So as you know that these healthcare devices are continuously pulling the large amount of data, and the information has to be stored and access to cloud is possible. Then the devices are analyzing your daily routine, daily sleep, your temperature and everything to inform the doctors, continuously preparing the charts related to health. So this is very much helpful in decision making process of healthcare of any patient. Now, this IoT is also used for better connectivity and economical aspect also, because as we have to go to the doctor and see the doctor and give information and then take the medicine, it's a long, long journey and a time taking process. So it is helpful in connectivity and economical part also. The Internet of Things in healthcare is responsible for the continuous exchange of information, better communication between different machines, and much more. They are using various protocols with connection of these devices, and then help healthcare expert to easily detect various diseases in patient with ease and discover new and effective treatment methods at their own place, at their own pace of time. That is very important for a doctor, as it is very difficult for them to reach to each and every patient daily basis. Moreover, a properly established technology reduces the cost by assessing superior quality tools and techniques, better distribution planning, and lower unusual doctor visits. As we have huge amount of data, then definitely healthcare also help in benefits of research, right? We can do statistical study on these data, we can do proper estimation. As you are knowing that presently we are working, the Department of Science and Technology is working especially for adult old age pupil health, or different psychological patients. We have meditation equipments we are making, and the medical treatments are possible using these devices also. So there are different use cases of healthcare system, like and various companies, tech giants are also working on healthcare system like Google, Amazon, Tencent in this industry. So what I'm talking about is the Make in India product, which can remotely check the patient's information. This is Dozy, and this is the wonderful product by make by Indian student, and this is the really extreme good project. You just have a look. Sorry.
Here's what convinced me about the importance of having Dozy as a remote health monitoring device. We had an elderly patient living alone. Her daughter had placed Dozy under her mattress so that both she and us could monitor her vitals at the healthcare facility remotely. This one time we got an alert indicating a decrease in her heartbeat levels from the device. When we inquired her regarding that, she just brushed it aside, telling that she was just feeling a little bit tired that day and passed it off as an age-related problem. So we called her in for an additional medical test and found out that she had an abnormal heart rhythm, and ultimately she needed a pacemaker for that. Possibly without Dozy, it could have been fatal for her.
Dozy is India's first contactless remote vitals monitor. Its thin sensor sheet, once placed under the mattress, tracks person's heartbeat, respiration, sleep, blood pressure, and even tiny heart valve movements with medical grade accuracy. Once connected, the vitals can be easily monitored on the smartphone app and on a patient monitoring system. A centralized web dashboard where hundreds of patients can be monitored at once. This is how Dozy is helping hospitals to monitor the entire ward remotely.
We are able to convert our COVID wards into step-down ICU within hours at a fraction of cost with Dozy. It has reduced the workload for both doctor and nurses and also exposure to the infection tremendously. This is because now we are monitoring COVID-19 patients remotely, as Dozy can be combined with SpO2 sensor too. The best part is we can customize alert for each patient and take a necessary action when required. This helps a lot in improving our daily workflow. At ESIC hospital, we are able to timely shift patient to ICU based on alerts.
Dozy can be used on any number of patients and with any commercially available mattresses. It requires no maintenance and it can even be integrated with the hospital's EHR systems through our APIs and SDKs. Dozy has been supported by the Government of India, Bill and Melinda Gates Foundation, and various other organizations.
With more and more consultations going online, Dozy is helping provide better healthcare outcomes to thousands of patients at home. It is also helping many leading hospitals to create step-down ICUs.
Continuous non-invasive monitoring of health vitals will be an integral part of future medicine, and we at Dozy are happy to provide it today.
I think Dozy is helpful for every one of us. And the other system with the IoT, what we can do is hospital information management system, inventory management system also, where the hospital can do outpatient management, inpatient management, administration management, laboratory management, finance and accounting, and hospital management too. So the other use case is inventory management in hospitals. As we know that there is the shortage of injections is going on, remdesivir injection, then shortage of vaccine is going on in present scenario. So if these injections are equipped with RFID tags, then definitely the information regarding their presence and the usage is also possible to us. Right now, Government of India has implemented it, and the vial which is open for vaccination, that number is also there with your vaccination part. So with your vaccination certificate. So this thing is implementing in India right now, but if with the remdesivir injection also it is being used, then definitely it is helpful for the patients which seriously require them, right? So it will make a request. The doctor needs an item, so it will make a request. Then it shows whether the item is available on the location or not with the help of RFID reader. And if it is available, then it will able to send that particular item to the particular room which require that particular item from the hospital. So this kind of information is very important for doctors as well as for the patients. But yeah, right now it is not that much easy to implement it. Then the second, another product which I come through is BPM code. This is also very important product for hypertension tension patients for their cardiovascular activities. Let me show you this also. So I think these are the various products we have seen and various applications we have seen in healthcare. So there are certainly challenges even every field of IoT also, not in healthcare, but yes, there are different challenges in IoT applications like varied standards and protocols we have to use, and we have to decide which protocol we have to plan and which device is important, because presently 100% for sure information is not available. Depending upon each and every device, we have to design its standards and protocols. We have to plan which system is important and how the devices are communicating. So this is a very important and main challenge for us who are designing these products. Second one is security and privacy. Definitely, the information of the patient and doctors need confidentiality, and availability of that data should be with the doctor only and with the patient, not to others. But cyber criminals can misuse it and create fake IDs to access the drugs that can be later used for selling or use data, which we are seeing nowadays. And this is a kind of fraudulent, but nowadays what we are seeing is not due to the IoT based healthcare system, it is due to the system which we are following nowadays. And definitely we are continuously sending the data every time, and we are getting this information, so it will increase our data overload, and we have to adapt a proper mechanism where to store the data, what is useless data, what is useful. We have to definitely filter the data, aggregate the data, then interpret the information. So this is also an important part. And using any healthcare device, there should be regulations. In US, we have NIH regulations, National Immunity Healthcare System, and in India also we are using ICMR for research in this. So definitely we do need a global healthcare regulation system for all these things. So, in my concluding remark, I can say that IoT has been widely deployed with limited to security. Security mechanisms are being developed nowadays. They are developed in the developing stage. Depending upon the application or the product, these informations are done. These parts are we are using the security measures. Though the data is huge, but the privacy is to be maintained, and that data is analysis is important, and continuously analysis of that data is important for the developer part, and giving the correct information to the user whatever it is required, it is important for us. Need scalable and practical solution in big data security privacy as well is important for us, as big data management and analytics is there. And definitely we have to need to develop technologies guided by policies to address security. And it is important that the impact of IoT on societal conditions is required. I think I'm very much clear. So if there is any question and answer, I'm ready to answer your queries.
Welcome back, ma'am.
Thank you.
It was a very wonderful session. You have covered the various points about the Internet of Things applications and features, and there are certain queries raised by our participants. I want to ask from you. Shall I?
Yeah, please.
What impacts with the IoT have an infrastructures and smart cities sector? Shall I repeat?
Yeah,
what
please.
impacts with the IoT have on infrastructure and smart city sectors? It might be incomplete question. I think the participant has asked. That means what are the impact? Might
impacts
be
of IoT infrastructure.
IoT. Yeah.
Yes. So definitely infrastructure is affected by IoT devices. We have to make each and every building network facility should be there, and these devices should be connected properly. We need a secure network platform. So it will affect a lot. In hardware part, it is not costly and it is not very much impacted. But for the software part, for the security and privacy, this for the software, it is very much expensive, definitely right now. But after some time, it is easily available to each and every person.
Yes. Thank you, ma'am. There is another question. Excellent alert device which will be easy to access and track emergency in a healthcare system. What are these, ma'am?
Excellent.
Yeah, excellent alert devices. Is there any devices available in which we can track the emergency in a healthcare system? This is the participant.
I think I have given the information regarding DOSI, and that is very important product which I found in my last 4 months analysis, because I also have a serious patient at my home, and he has a hypertension patient. So I found that particular device, and it is very useful at my personal level, and it is a great alert system for the health of particular patient which is suffering from hypertension. Both the devices which I included in my presentation, I'm using them itself at my home, and they are really helpful for my doctors as well as for me to find out the condition of the patient in day-to-day situation.
Thank you, ma'am. There is another question. Will IoT be used in the future for the same? And if the answer is yes, what about the infrastructure?
Definitely, infrastructure costs you. Like these machines, Dozy is just 8,000 cost bucks of instrument. Definitely, these machines are expensive for right now because the production is less. When the production increase, the cost of instrument is less. And as we are in the fiber network era, so internet cost is just bits for us, and transferring this information, the cost involved in these devices is the major cost which we are using right now. For the internet or network part, or for the software, they are not charging. They are giving the subscription for 1 year or 2 year depending upon their terms and condition of usage.
There is another question, ma'am. Do we need to get a C certification for IoT medical projects developed?
I think I don't have this kind of information with me. Yes, NASCOM is giving certifications for the trainers as well as for the student for IoT. And these are the really important certificates, I must say, which all over India, they are useful and they are valuable. They are counting in your resume, these IoT certification. And in this TICU project in which I am working, we are giving the training to the students and faculty with the help of NESCOM itself and IITs for these 9 major aspects what NESCOM is doing with IoT, robotics, 3D printing and other parts, and the certification to the trainers and to the student for their further job placement is given by NESCOM itself. So I think these certificates are important. I am exactly not known about the doctors, how they will use it, and what kind of certificate they require for using these medical devices.
Last question, ma'am, from the participant sides. Is this equipment these equipments are costly one and not easy to monitoring? How to maintain maintenance? And actually, the
These
maintenance is the
yeah, I understand the question. These equipments are exactly not costly as per their information or the analysis they are providing to us. They are not that much costly, I must say, because 7-8 thousand is not important for you if you have a patient at your home or your parents who are living apart from you, and you are residing at other city and they are residing in other city, and continuous monitoring of their health, providing the pills on time. We have the products that can help them to get the pills on time. We have the products to get their information about their heart and everything. So these equipments are not costly as compared to the health issues which we later on predict, or we later on get the information. I think these equipments are important right now because everyone is alone in this COVID situation. Everyone is only with their family members only, not with others. And we cannot go and see the other persons who are also our family, but they are living apart from us. So monitoring them, helping them in this way is very important.
Thank you so much, Preeti ma'am, for delivering a wonderful session about the IoT.
One Varsha ma'am, can I ask the question?
Yeah, yeah, sure. Over to you, sir.
Yeah. Good afternoon, ma'am.
Good afternoon.
I think you are called from the COVID, and
yes.
Can you tell me, because this is the real-time experience, that when you were in the COVID era, then at that time, do you remember that there should be the telemedicine should be there, or something, the telehealthcare should be there?
Yes, definitely. Definitely, because I have to chat with my doctor using WhatsApp or Skype calls, and I have to contact them. But telemedicine is really important to provide the medicine to the patient. This is the most important topic right now for the patients who are suffering from this isolation stage or a quarantine stage. And these products which I have shown is also helpful for me to monitor the patient at my home, because I have to go to other place in my this pandemic in this COVID situation. So I am unable to live at my home itself, so I have to go somewhere else, and I have to monitor my patient because he need continuous medicines for that, and I have to give reminders to him related to that. And these systems help me. And definitely telemedicine and smart healthcare is very important in this situation. And as per WHO, we have continuously till 2028 we have different kind of pandemics in the world. So these healthcare and telemedicine is the most upcoming field which are required for every person. So the topic of your FDP is really, really very good, which is important for every person to know how to use it, how to produce the products using different IoT devices for this, and it is very important for everyone.
Yeah, ma'am, this question was because our participants, they are in the pandemic situation is going on now, and it is in very critical stage. So I asked this question with the familiar that all the participants, maybe there is a pandemic situation that their home or not, they can be monitored with the help of the telemedicine. Ma'am, my next question was that this was your topic introduction to IoT. How you see that the IoT that is towards the telemedicine? Can you explain, ma'am, somewhat regarding that? Where's IoT in the telemedicine?
Yes, because with the telemedicine and smart healthcare products, now every product which is going to be smarter or helpful in health issues, they are produced using IoT sensors only, and these microcontrollers, this communication gateway is important. So IoT is helpful for producing these products.
Ma'am, can you suggest this one of the product that you have gone through many products, just like the Dozy app is there, that products are there. Can you somewhat explain regarding that Dozy, because there was somewhat video, but what is inside that Dozy regarding IoT and regarding the telemedicines? Somewhat, because I know you use the some other products also when you are in the that is this pandemic situation era. This one.
Yes. Let me show you their website and their warning system, what they are using.
Ma'am, please share
How?
the screen.
Yeah, just a minute. Huh?
because this is very fruitful for our participants or of our panel members also.
So this is the outcome. This is the website of Dozy Health. They are using it for the critical care outreach automation, nursing efficiency, and maximum ICU bed, through which they are using the impact of their work. So impact is they have installed in 179 hospitals, 3683 Dozy beds are there. Patients have 25,562 patients are continuously monitored using Dozy, and nursing hours saved is 56,236. And timely transfer of patient from the normal rooms to the ICU beds is 66639. So this is very important for everyone. And the hospital care system is also there. This is the software that they are using, customizable alerts, health trends, parameters that are monitored in Dozy are your heart rate, respiration rate, oxygen saturation, blood pressure, sleep stages, cardiac performance, sleep apnea index, heart rate, stress, snoring index, because restlessness is can be monitored using snoring. Your stress is also monitored using your snoring index. Your blood pressure is also very important. Heart rate changes as you are stressed. So these things can be monitored easily with the help of Dozy. So I think this product is very important. Now, presently, it is not available to individuals. Initially, at the initial stage, 4 months back, it is available to individual patients, but right now it is used in hospital care only because they have limited production, and they are into increasing the production. But initially, due to this COVID-19 situation, they are using it only for the hospitals. You can go through the product as well as their publications and their case studies. That is helpful for the research purpose of the participants who are there here for this workshop, who are into the research part. This is also important for them.
Ma'am, can you provide the link in the chat box of this one?
Yes, I can.
Ma'am, please select the panel and attendees. And the participants are very much saying that your session is very appreciable. So they are demanding the email ID. Just please provide the ma'am email ID that they can communicate with you. And ma'am, one question from Gayatri Nanda. What is on-demand virtual healthcare portal?
On-demand virtual health portal is a kind of a portal which is used depending upon the user. Like we are using AIMS portal for our registration purpose, our getting the reports of ours. This kind of portal which our hospitals are giving to us for the registration, like Geo Health is there. This is also an online hub for taking what we can say doctors appointment, sending your reports to the doctors. They will send you the prescriptions. This kind of portal is available right now, and new things can be done. Like Practo is there, Geo Health is Geo Hub is Health Hub is there. So there are various platforms already which are working in this field. But definitely they have some flaws, and new portals are required for these things.
Okay, ma'am. That is one more question that because I said earlier that you are from the coming from the COVID pandemic situation. So what is the message to the participants that how they can handle this pandemic situation? Because this is the telemedicine and healthcare, and our theme is that because I have seen that in is there one family in the one family to two persons they are the positive, the third member that's automatically depressed. Why they are the positive? What I will do? What I will not do? And because you go through that the pandemic situation, I think so that situation that will be in your mind also. Everybody is there. We are the human being. So, ma'am, how we can handle that situation? Because you can give the close aspect regarding the my question. I think so.
Yes, definitely. I think those who are suffered from this disease are also in depression if they go to the hospital. The first thing is avoid getting hospitalized till your oxygen level is 85 in your oximeter, 80 to 85 in your oximeter, so that you can be in comfortable situation at your home. uh, if you are getting lesser oxygen information from your oximeter, then definitely visit to the hospital and try to avoid in contact with some other person of your family. With in isolation period, try to contact to your doctor definitely twice a day and inform each and every situation, because every day the health gets changed. Might be you are getting the fever 99, another day 98, and again 100. So this kind of situation, or you are in the getting the loose motion or headache or anything, because within in these 15 days time, there are so many situations which occur in front of you in different health issues. And this black fungus which is coming, if you have a simple pain in your jaw, then definitely inform your doctor, because the same thing is happened to me also, and I got cure for that on the same time. That is why it is not increased. As well as try to be motivated and get others motivated in your family who are living apart from you, and help them to be happy.
Thank you, ma'am. One more question, that the third wave, that is government is saying that third wave will come and that will affect the children. So, in your point of view, how can we save the children from that pandemic situation?
It's really very difficult to save the children from this situation, because they cannot understand to live without you.
Yeah, yes.
So they are part of us. If we are living in a joint family situation, then definitely somewhere someone is there to help them out and give all their necessities. But if you are a neutral family, it's very difficult to check with your uh, kids. But definitely there are some medicines, precautionary medicines, which you can give to your children, so that they can not come into this situation. And
Ma'am, maybe we can mentally prepare the children regarding that if the situation comes that you should be away from your parents, and if you go for the that in this situation that we mentally prepare the children, then they will mentally prepare at that time. If you will say that you will not go with that or you will not sit here, then I think so they will better understand that way. That is the
yes,
correct way, ma'am.
yes, yes,
Can we
definitely.
go through that?
Yes, yes.
Because the
Definitely.
isolation is main, and the if we say to the children at a time that you are the isolated, that they will be nervous. If we'll go for that the from today onward, that if there is situation, you have to take care regarding that, you have to sit here, you have to that is the study here on this table, you will sit on this table, you will that sleep in this room, you will eat like this, that can be it will be helpful for the children, ma'am.
Yes, yes, definitely, definitely.
Okay, ma'am. Thank you, ma'am. And over to you, Varsha, ma'am, please.
Very informative session, ma'am. You have given a maximum answers to all of the questions of Rakesh sir, and in fact of the participants which I have asked from on their behalf.
Ma'am, excuse me, members. Ma'am, one question from the participant. The question is very interesting, so I am saying you. Question is from Vivek Gupta. He is saying that he is asking you, ma'am, had you taken steroid as you have talked about the black fungus?
No, I have not taken even any allopathic medicine.
Okay,
I have taken
now
only homeopathic, and I am cured with the homeopathic.
okay,
So
Vivek sir, I
this
think
is
so
the
you have answered. You have
major
got
thing
answered
which
question.
I came through, because I don't have to take any steroid or remdesivir or any kind of these kind of injections which are harmful for us. So I'm totally cured by homeopathic.
Thank you, ma'am. Over to you, Varsha, ma'am.
Thank you. Thank you, ma'am, once again. And all the participants and all the coordinator till now, Nitesh sir and Ankit sir, who has coordinated very well for the session 7 and session 8. And at 3 o'clock, we will rejoin for the next session. Till then, bye. And thank you once again, sir.
Thank you. Thank you, everyone. You can contact me on my mail ID if you have any questions. Right. Thank you.
Thank you, ma'am. Thank you
ma'am.
once again.